It is 1 o'clock. Call the Board of Supervisors back into session. We have a budget work session scheduled from 1 to 4. We'll be starting off with.
Sure, I'll just give a quick introduction. Good afternoon, everyone. Today we have a couple of different departmental presentations on the agenda. We'll start off with an update from our health plan representatives, Cottingham and Butler, on our county health plan. And then we'll move into departmental presentations from our MHDS department and also our IT department. So I think I saw Sarah and Ashley both on the line. Yep, there's Sarah. Hi.
Hi there. Can you hear me okay?
Yes.
Great.
And do you want me to share your presentation or do you want to share it yourself?
I can go ahead and share it if that will work. Let me just make sure it. Oh, it says host disabled participant. I'm not able to share it. Are you able to allow me to?
Yep.
Okay.
Give that a try.
Wonderful.
Okay.
Can you see the first page? All right, wonderful. How much time do we have today, folks?
8 minutes.
8 minutes. Oh boy. All right, we can hustle through this then.
I was kidding, Sarah. I was kidding, of course.
You know, I can talk a lot longer than that. All right. Well, the primary focus today is obviously to give you an update of the fiscal year 2023 renewal. But we've got a lot of, we have a whole bunch of slides here so we can talk about kind of historical data, where we've been, where we are, and then moving forward, what strategies, if we have time today, what you want to talk about. So I'll just start to buzz through if that sounds okay with everyone, and please interrupt me if you have any questions.
Well, can you introduce your team?
I sure can. So my name is Sarah Dickinson. We're from Cottingham and Butler. I also have Ashley on the phone. Most of you have met Ashley. She is our account manager for Dubuque County, and she works with many of the ICT, the Iowa Community Trust Groups. We also have Sandy on the phone. Sandy is one of our new producers in one of our Wisconsin offices. Sandy's going to be spending a lot of time in the public sector. So Sandy's just joining us today to kind of listen in and learn. And I think that's all we have from CMB. Is that right, Ashley? I believe so. Okay, perfect.
Great.
So please stop us at any time. You can use the chat box or just shout out questions as they come along. All right, see if I can get my technology to work here. All right, so our agenda, like I said, just a little bit of a historical recap, what our upcoming renewal is looking like, how the plan is running year to date. So how has it been running since July of 2021? Some strategies we've discussed historically, things that we have implemented, and then ideas that maybe we've just discussed both with the board and the insurance committee. So first, kind of an executive summary. I'm not going to go through this line by line. It kind of gives you a recap of the last few years and how the renewals came in. In 2019 and 20, so for fiscal year 20, it looks like we had roughly an 11% increase to our premium with Wellmark. Remember, we've got our Wellmark premium that we pay, a fully insured premium. And then when we talk about the 8.26% overall increase, that is slightly lower because it's taking into consideration the split funded claims in our HRA that kind of fluctuate from year to year. So our overall increase was just over 8% for fiscal year 20. For fiscal year 21, it was just over 9%. And this upcoming year is looking just under 8% for an overall increase. And we'll get into some of those details. So this again is just a recap from past renewals. We can jump back to these if you would like. Just to refresh your memory, back in fiscal year 20, we moved from a $5,000 per person deductible up to a $7,900 per person deductible, so that the county was buying less insurance, taking on a little bit more risk with that self-insured middle piece. And it resulted in some savings for the county in both in that year and then in the years to follow. So fiscal year 21, again, that was just over a 9% increase. Fiscal year 22 was roughly a 4.4% overall increase. And now we're going to be talking about the current year renewal for fiscal year 23. So the renewal came in at a 9.62% increase for the Iowa Community Trust Group as a whole. So just to refresh your memory there as well, every group that is part of ICT receives the same percent increase. But each group can be choosing from a different plan and their rates are all different. So a 9.62% increase to you, Dubuque County, is going to look different to say from Jackson County or one of the other counties or cities that are participating. But that 9.62% fixed cost increase equates to about $480,000. So although it's single digit, which this year has been, to get a single digit renewal has been somewhat of a good year, if you can believe it or not. But that does equate to almost $500,000. So when we take into consideration our claims that we spend, where we buy the $7,900 deductible from Walmart, but our employees, remember, only have a $300 single or $600 family deductible and out-of-pocket max. So the county self-funds the claims in between there. So when that is taken into consideration, our increase is only 7.66% is what it shakes out to be roughly. Moving forward, in working with Dawn and Stella and the team, we're looking at potentially decreasing the budget for what we are budgeting for that split funded piece between the $300 single and the $7,900 that we buy from Wellmark. And in which case, if we do so, that would lower where our renewal would come in or what we should budget for the renewal by a few more points, bringing it to about 5.78%. So I'm going to stop there. And Stella, is there any other light that you would like me to shine on that, or supervisors? I'm assuming there's going to potentially be some questions there. Let's see what I've got upcoming here.
Sarah, can you explain it again a different way?
The decreasing the budget or the renewal?
The decrease that Stella and Dawn are proposing.
Okay. So historically, you'll see this number up here, 24.2% of maximum. So if we buy from Wellmark, I have to get my calculator out here. I apologize, Ann. We buy a $7,900 deductible on each person on the health plan, right? A single $7,900 and a family is double that. So when we have a $7,900 deductible, we subtract out the $300 the employee pays, and then the employee is also on the hook for their co-pays, both for drugs and office visits. But that leaves just over $7,000 of exposure that the county could have to pay on my behalf, right? So let's use an example. If I have my hip replaced, right, I'm going to spend a whole bunch more than $7,900 on the health plan. Let's just say that claim is going to be $40,000. I'm going to hit my $7,900 deductible. So the county is going to be on the hook for everything that I'm not responsible for, which is just over $7,000. So we have a maximum exposure per person. That is our maximum exposure. So in past years, we have said, we're going to assume we're going to spend 24.2% of that maximum number. And then we divide it out by singles and families to get to our annualized, what do we think the county's exposure is in split funded exposure? Meaning the claims between what I, the employee, am responsible for, and when does Wellmark start picking up the bill? There's just over $7,000 in there. That's exposure to each person. So what we're saying is, and we talked about this a long time ago when we first started being split funded, it takes a little while to figure out exactly how much of that maximum exposure you're going to use as a group. And it's going to fluctuate slightly from year to year. So when we moved to a higher deductible per person from 5,000 to 7,900 a few years ago, we had to kind of readjust that again. So that's why Stella's saying, hey, I think we might be budgeting too much. And so we don't need our fund to grow too heavily. We think that we should decrease the budget to about 10% below the current budgeted amount. So basically we're saying we want to put less money in the fund every month because we're not spending it.
So does that take the number to 14% then?
We don't have that listed here. Is that?
It is then 22.2%.
Because it's 10% off of the number that we were utilizing, not the percentage. Right, Ashley?
Right.
So what would this percent number, so it would be 22 what?
22.2% of maximum then.
So then right here, we should put the 24.2% of maximum, we can put the 22.2% here.
Yes.
It's an estimate. We're going to pay whatever.
Ashley, can you take yourself off? There's a lot of background noise. Correct. It's an estimate, but we're still pretty conservative in what we've been spending. So we believe that that's still going to be a conservative number for us to use.
How does the number that we estimate, how does that impact the cost of the insurance if we pay the same claims anyway? I've never been presented before with the concept that Stella or Dawn can readjust the claim number. I've never been presented with that information. Maybe you've said this a different way other years, but I've never known that the county gets to select how much we set aside for our insurance. I thought we did that based on your recommendation.
It is. And so in past years, we've given a range of where do you actually spend and giving it somewhat of a buffer, knowing that claims could be higher. Especially with COVID related years, there was kind of uncertainty there, right? So we do, and Stella then agreed that because we've got a few years under our belt of spend, that we feel comfortable, the county feels comfortable now lowering that just slightly to get a little closer to where we've been spending.
So you're the insurance experts, and so going with you is what we will do. But I think people have generally taken less care of themselves. I think that's what the research shows, at least general knowledge, that people may have built up health issues that they have not been attending to because of COVID. So I'm concerned about, I mean, ultimately, these are all determined risks that you wish to accept. But why would we reduce it this year?
So Anne, this is Stella. I can jump in quick. So the way that we process our health insurance, it comes through payroll. So it pulls it out of our general supplemental fund and puts it to our 0005 health insurance fund. And that's where we pay our claims from. So we're charging ourselves a number, an estimated number, and then paying actual claims out of a different fund. And so what that's done over time has increased the fund balance. So that health insurance fund balance is growing, and we're saying, okay, we're averaging about $900,000 a year on HRA claims. We're budgeting higher than that, which is the right thing to do. You don't want to be short, but we don't want that fund balance to grow to an unreasonable amount. So this is a readjustment of where we think that fund balance needs to be and how much we should be budgeting against what we're charging ourselves.
Okay, do you have anything?
Anybody have any questions about that? Okay,
To your point, Ann, we can absolutely keep the percentage where it is because you do have valid points in that the last few years of COVID has changed a little bit how care has been sought, and, people could potentially have built up issues that they haven't been taken care of. We're seeing a lot of that with dental claims on our self-funded groups there. But there's really no way to fully anticipate what that's going to cause for your fully insured plan. So we can keep it 24.2%. You can't, there's not a wrong answer here. I think our goal has just been to get it a little closer to where your actual spend is so that the fund balance doesn't grow to a point where it's not necessary. But ultimately that's up to the board. Our suggestion would be between the 22 and the 24%, which when we first started split funding in way back years and years ago, we were funding to 54%. I remember that number off the top of my head for some reason, because we really didn't know, because we have such a rich, great health plan that we offer employees where they have very little out of pocket. Usage can be higher. So we started with a high number, and each year we've kind of whittled that down to where actual spend really lies.
Thank you.
So I'll continue on. If there's no more questions there, we can always come back. We did look at, just like we did a few years ago when we moved from a $5,000 deductible to a $7,900 deductible to pay less in premium. We looked at the option to buy an $8,700 deductible. Each year, the IRS adjusts that maximum that is allowed. So we did take a look at that. We don't feel that the savings we don't believe the additional exposure is worth the small amount of savings that it produced. So we're not going to recommend that to you, but we definitely wanted to show you that we looked at that as an option. It would increase, it would be about 1.7% less, or a savings of about $93,000, which could be offset by the fact that we have additional liability now for claims between $7,900 and $8,700. So again, we don't feel that that's a good option for you, but we wanted to show that we kind of did our homework on that just to see what those numbers would look like. Let me continue moving on here. So in past years as well, we've always looked at different funding mechanisms. Years and years ago, 12, 13 years ago, we were straight up fully insured, meaning we paid a premium to our insurance companies, and that was the premium we paid the entire year. There were no additional claims. There were no additional costs. We now are split funded, or the HRA buy down health reimbursement arrangement. It's a buy down plan. There's additional funding mechanisms. Level funded is kind of a hybrid between split funding and self-funding. We've got captive options available. And then in the last few years, we've more seriously considered self-funding, which we have requested quotes on. And Wellmark will be releasing them once the ICT group has decided if they're making plan changes. So we'll have additional information on self-funding options in the very near future, but we don't have them today. They're not releasing them to us yet. In past years, we've talked about some other strategies with the Health Insurance Committee to educate them on, maybe not this year, but in the coming years, different strategies that other groups across the country are implementing. In the past, we've done a dependent eligibility audit, basically confirming that everyone who's covered under our plan is supposed to be covered under our plan. We've looked at opt-out initiatives. So either based on tenure or just being a full-time Dubuque County employee, basically saying, we'll pay you money to go get your health insurance elsewhere. We've looked at spousal provisions. Spousal provisions can include anything from saying, if my spouse works at the school district he is not eligible for the county plan. He has to take his coverage elsewhere. That's a carve out. A spousal surcharge would say, well, your husband can be on the county plan, but he's going to have to pay an additional $100 a month since he has coverage through his own employer. So there's different types of provisions there where we try to encourage or mandate that a spouse be covered under their own employer's coverage. Now, in the situation where, say, my husband is a stay-at-home dad or a farmer, let's say, he's employed, but he does not have coverage through his employment, he would be able to stay on the county plan. It's only if you have coverage offered through your employer that you would be either intrigued off with an opt-out or saying that you would have to pay more to stay on the county plan. So we've talked a lot of detail about that. We've talked about wellness programs, incentivizing folks to be healthier. We've done some Medicare education to encourage folks to research other opportunities for coverage. There's a whole bunch of different strategies that we're constantly talking with the insurance committee about and educating them on. Any specific questions about any of those? Okay. So plan year update. So from year to year, we like to keep kind of a rolling monthly. How are we doing? How's the plan? How's the plan spending? This is a lot. This is probably some small information here. So actual versus budgeted. So where are our claims? This might give you a little bit more detail of the dark blue line up here is where we budget our HRA claims to come in at. And the blue line is where they actually are each month. So you can see each year and each month that fluctuates greatly. Okay. So claims versus premium fluctuation. So this is our Wellmark premium. This has nothing to do with our additional claims that we're paying. This is the blue line is the premium that we pay to Wellmark for that $7,900 deductible plan. You'll see it fluctuates slightly when we have ebb and flow in our participation, meaning people coming in and off the plan. And our red line are our claims. So the blue line is what the county pays Wellmark in premium. And the red line is what Wellmark is paying out in claims utilized by employees or participants. So you'll see in fiscal year 19, the Dubuque County loss ratio was 105. The ICT loss ratio as a whole was 103. Now, when we talk about loss ratio, we're saying, what did you pay in versus what did Wellmark pay out? Basically, did they make money on you or not? In fiscal year 20, again, much lower, but 87% was Dubuque's, ICT was 84. In fiscal year 21, Dubuque County had 103% loss ratio, and the ICT group as a whole came in at 85%. So what that tells us is that it's benefiting Dubuque County to be part of the bigger ICT group versus being solely on your own, fully insured. We always like to talk about our benchmarking comparisons to show what a wonderful benefit Dubuque County offers their employees. There's a $300 single, $600 family deductibles. Your out-of-pocket max. So if wheels fall off the bus and something really bad happens to me, the most I'm going to pay in 1 year's time for medical and pharmacy is my $300 deductible plus my $20 copays for office visits and copays for drugs. And when you look at the national or Midwest or state and local government benchmarks, out-of-pocket maximums range from $3,000 to $4,000. So our employees have a really, really great benefit. In addition to the fact that they're paying very little for that benefit. So a single pays roughly $50 a month and a family pays $120 a month, when the rest of the world is paying usually roughly over $130 for a single, or over in some situations over $600 for a family. So there's nothing wrong with the county offering that. It's a really great benefit, but that's why we try to take a lot of time to educate employees on this benefit truly being part of their compensation package and what a wonderful benefit it is and what it would cost them if they had employment elsewhere. To have a benefit like this, what would it cost on a monthly basis?
Sarah Ann again, have you ever looked at these numbers? So I see you're doing Mercer and so forth, Midwest, National, and whatever, but have you ever done this benefit analysis between the other members of the ITC?
ICT. Ashley, do we have that benchmarking? I know we have in the past. We don't have it in this presentation, but we.
Yeah,
Ashley.
I have it and I can get it added.
Okay.
I know.
Sorry, Ashley's in the office. It's a little loud there.
Sorry, yeah.
Okay, thanks, Ashley. Yeah, and we do have that, and we can get that to you and the other board members as well.
An insurance office.
So then we go into some historical marketing recaps just to remind the board members of all the marketing efforts we've done in the past, primarily just to bring light to, we feel that what you're doing today with Wellmark through ICT is benefiting the county. We've looked at medical associates, United Healthcare. We've looked at self-funding with both Wellmark and UMR. UMR stands for United Medical Resources. It's a TPA, a third-party administrator owned by United Healthcare. Dubuque is a little bit of a different scenario than many large cities in that you've got Wellmark that encompasses the largest amount of doctors. You have United Healthcare that includes many of the independent docs, but does not include medical associates. And then you've got the medical associates doctors that it's more of an HMO setup and a smaller network when talking about maybe nationwide access. I'll tell you that United and medical associates always want to look at your business and are always wanting to, win your business back. They've both had it at one point, but it does change the network and it does change the formulary for your employees. So again, we just go through year over year marketing results and what they looked like. Previously discussed strategies. We already talked a little bit about that. We talked to the committee last week about the employee rate and what they pay for their health insurance. And if they were at the government benchmark, how that differs from the low cost that they're paying today. And then, different strategies that we've both implemented and or discussed. As of January 1st, all full-time employees are now covered for long-term disability insurance, which you, the board, voted in favor of. So as of January 1st, all of your full-time employees now have up to 2 years of long-term disability coverage, God forbid anything bad happened to them. So we'll spend some time during our open enrollment meetings this year really educating on what that means and what type of the enhancement to the benefits package that was made because of that addition. We've talked about other strategies, again, changing copays to different funding mechanisms, tenure-based opt-outs or opt-out programs, those types of ideas. So I'm gonna, with that, I'm gonna stop and pause and we can go back and discuss any of these areas with you. But what questions do you have for us?
Sarah, is there a way for you to monitor how much we're paying on our self-funded basis for COVID claims? And because I think that's arguably reimbursable by our ARPA funds as a budget consideration.
Okay. Ashley, I don't remember the last time Walmart gave us an update on that, but can you request that from Walmart?
Yes, I can.
Okay, thanks.
Plans.
So they can, and yes, we can get that from Walmart, and we've gotten that in the past. So that's something that Walmart can pull for us.
Thank you.
Mm-hmm. Jay or Harley, any questions?
I have nothing.
I just had one question. If those that were involved in the insurance committee discussion, you mentioned that, any other high points or topics of discussion you could share?
One area that came up again was the opt-out options. We've talked in some detail in past years about offering an opt-out option for employees. Instead of taking county insurance, we'd pay them a monthly sum to get their insurance elsewhere. That kind of halted a little bit when COVID happened 2 years ago. But there's definitely some interest still in offering that. Our insurance is so low cost on a monthly basis that I feel many people could be intrigued to go to their spouse's plan, or maybe Medicare or somewhere else, but they take the county plan because it costs them very little each month to do so, and it's really great coverage. So for example, let's say I work at the school district and my husband is a county employee. If I work at the school district, I believe my coverage is free for a single. But if we have 2 kids, my husband is carrying a family policy under the county. And so I would automatically be covered over there under the family when I already have coverage over here. And I might be a high cost claimant that's affecting our renewals, right? In addition, there's folks that may look elsewhere for their coverage, or depending on what that monthly sum is, they might strongly consider moving everybody to their spouse's plan. So that was probably one of the main areas.
Thanks, sir. This is Dawn. One other comment that was made is that we do have, it was noticed by one of the members that we do have a little flexibility in being able to increase our deductible amount, that $7,900. So there was question if there was any discussion of maybe increasing that would reduce the premium increase. And I think it was going to be very slight, or a very small amount, if I remember correctly.
Yeah, it was about $93,000. But then that could potentially be eaten up with claims. So it was definitely not, it was not something that we would suggest for this year.
Right, the exposure outweighed the gain there.
Or yeah, the potential exposure just wasn't necessarily worth the risk. So the premium for this alternate plan was 1.7% or 93,000 less than the current renewal premium. So it would change your renewal. We're thinking right now an overall increase will be let me see here. 7.66% as compared to 7.06% for that change. Other than that, I don't believe there were, the Health Insurance Committee was a little quiet this time, unfortunately being via Zoom. So there wasn't too much conversation around those other ideas at this point, but that opt-out did get brought up again. Also, they were, excited about the long-term disability and just wanting to make sure that we talk to employees about that at our open enrollment meetings to explain what that benefit is and how it will potentially help them if they need it.
Sarah, did they have a plan for like yourself and your spouse instead of a family plan? You know what I'm saying? Just a husband and wife.
Like an employee plus one plan.
Right.
So, yeah, Harley, we've looked at that in the past, sort of, not in too much detail, but we definitely can. So what you're referring to, I believe, is right now we call what you have as a 2-tier rate. You have a single or you have a family. And an employee, so my daughter and I would be considered a family. Some groups have a 3 or a 4 tier. 4 tier would be employee plus child or children, employee plus spouse, and a family. A 3 tier is many times what I think you're talking about would be employee plus 1. But for cost saving purposes, although that would be beneficial to the employee, if my groups move to a 3 tier program, we typically suggest that that middle tier be employee plus child or children, that an employee and a spouse should still be considered a family because spouses cost the plan more money than children do. So you can tier it that way. But when you look at where your claims happen and who is having claims, children are much less expensive than spouses or employees. So we want the employee and the spouse to still pay potentially that family premium. But we can look at it any different way. The problem when you add any tiers though, then what happens is the family ends up having to pay sometimes significantly more.
I think I follow your logic. My kids were very expensive. Just kidding.
Mine is. Yeah, that's a great point though, Harley. We have looked at that in the past. Especially right now for recruitment and retention purposes, you know, what a lot of groups that I'm working with talk about is how can we recruit more families and how can we be family friendly, you know, especially for single parents, giving them a break. So when it's just me and my daughter, we don't have to pay a full family premium, but there would be a middle tier for employee plus child or children. We have that at Cottingham and Butler, actually. We have 3 tiers. It's employee only, employee plus child or children, and then a full family. And a family means there's a spouse on the plan.
Okay. Anything else, Ann? Or-
I think, this is Stella again. I think what we would like consensus from the board, if you're comfortable moving forward with the renewal and the reduction in the HRA budget as proposed, instead of 24.2% of maximum, the 22.2% of maximum on the budget. So that would equate to a 5.78% overall increase to our health insurance budget this year.
I think I would be okay with that, Jay.
And me as well.
And
If that's their recommendation, that's fine. Like I say, the confusion was that I've never had a recommendation from Stella about this before.
okay. Sounds like consensus.
In the
Stella?
end, just, yeah, in the end, it's all coming out of general sup. You're just putting it in a subcategory, right? So
Yes.
it's not changing the whole. The source of the budget and ultimately the cost will be what that cost is. This is just a budgeting item.
Correct,
The money still sits there.
correct.
Thank you.
Okay, thanks, Stella.
Okay, thanks, Sarah. I think that's everything.
Thank you. I apologize. I went a little over. If you
Thank
have
you,
any
Sarah.
questions,
Thank
please
you.
reach out.
We will.
Thank you very
Thanks,
much, Sarah.
Ashley.
Thanks.
Thank you.
Nice to meet the rest of your team.
Yep.
Okay, so next up, we have Ann Cameron here for MHDS department. Let me get.
How's everybody today?
Wonderful.
It's still cold outside in case you're wondering, just so you know. So as Stella is pulling up my little presentation here, I just want to really thank Stella for her assistance in helping me get to where I needed to be for today, and also May for her support, her information, And she's pulling for me over there. So I really appreciate you being here as busy as you are. So thank you for doing that. So our budget presentation for your consideration today is quite unspectacular in terms of anything wild or unexpected. It is paying for, we're aiming to pay for staff, for occupancy, for supplies, for some computer, just some minimal computer technology for our patient advocate. And that's about all that's on deck for this budget. One of the things that is different is I did take off for consideration the Take Care Center, which was originally an ARPA vision in all of its glory, but after continued further exploration of it and getting May's input in terms of what is best for the region and where it might sit best for region and for our counties and for most importantly, the people we serve, that effort could be explored in the future as something that either providers or a collaboration of providers could explore together. And that could be, funded by other sources from the county. So with that, I thought it was just best to pull it from consideration at this time, open up that $2 million for somebody else to use to good purpose. So that's sort of it in a summary. If we could go to the next slide, thanks. So one of the things that in some of the budget meetings, prep meetings that I had with May and with Stella is the recommendation to the board to consolidate what was formerly known as Department 61 and Department 60 together. Although I believe that some of the funding would still be pulled from a separate account for substance use. Is that correct, Stella?
Yeah, so substance abuse.
I'll just repeat what you're gonna say. So it's on the second bullet. Oh, go ahead. You can go ahead. Substance abuse monies must come from a different line item, a different funding source. So you can see that in that second bullet there, we've accommodated that in the consolidation of Department 61 and 60. So Nancy, May, me, Shelley, and the to be determined person in fiscal year 23 that would act as a part-time administrative assistant would all be that Department 60. And it's nothing changes, the occupancies will be blended. All of the stationery and supplies and everything like that would still be blended. So it's an efficiency of process, basically. Has absolutely no difference in how our department operates. Next slide, please. So just for your information, these are some of the Iowa code references that I believe have been presented before in former years. And it talks about the region governance structure, the need for a patient advocate, and Iowa counties provide the need for Iowa counties to provide payment for costs related to involuntary substance abuse commitments. Next slide, please. So the budget request for fiscal year 23, after you add up everything, comes to $517,930 for operations, and then a carve out of that $75,000 for substance abuse commitments. So the total is what we're looking at is $592,930. And the changes there are due to consolidating the departments and eliminating the full-time, actually Jesselyn was a clerk. So we have eliminated that position and we are looking for a part-time administrative assistant for the, to support me and some of the things that I need to do. Next slide, please.
Please go back to that last.
Oh, sure. Go back,
slide here.
please.
So just make sure I'm following your math. So if you take the fiscal year 2022 and add those three numbers together. And then compare that to fiscal 23, the 592. Is that a fair year-over-year comparison? Is that what you're explaining?
Correct. There has not been a lot of fluctuation in there.
Yeah.
Stella, would you?
587, so yeah, it's a modest increase.
Yeah,
Okay, thank you.
okay. So I believe you've got the actual detailed budget that Stella had prepared. Some of the questions, and forgive me if I can do this better next year after I get a little practice and guidance. So any guidance you have, I really appreciate. But some of the discussion that's been bubbling and some of the questions that I have, and perhaps the Board of Supervisors might also have, there has been a consistent discussion of substance abuse needs of the county. And that at the moment, there's no one person at the county that is responsible for anything regarding that particular issue. It is a public health issue. It is also a mental health issue. And so some of the discussions about substance use have included, you know, we've been at a $75,000 line item for a long time. Do we need to increase that to $100,000? And quite frankly, looking at what we have utilized out of the 75,000, we have not come close to spending that entire line item. However, if we decide to do something a little different, if the county decides to increase and expand some of its response to people of Dubuque County, then an increase could be warranted. At the same time, I'm not sure that we're utilizing our current line item as efficiently and as productively as we could. So some of that money is just sitting there, but because there's not a particular push from the county to do more with that money, I think there's some opportunity there. Some of the conversations, and I've had discussions with many of the people in this room about a potential carve out of my time to pursue some very preliminary activities to see if and how Dubuque County in the future could have a bigger footprint in terms of responding to the needs of Dubuque County and the systems that serve them, people with substance abuse issues. And so talking about perhaps a 20% carve out of my time for fiscal year 23 to do the bullets that I've noted there, just sort of an overview of the scope and services for substance abuse that currently exist and what's not here. What are the implications of substance abuse on our systems of care? Studying how substance abuse is affecting individuals, families, businesses, and educational systems in the county, and a review of how other counties are addressing this problem. So sort of a capture of bright spots, not only in Iowa, but perhaps in a larger scope, to see what are some of the star players out there and how are they doing it? How are they helping people? These are skill sets that I have. And as I was talking to May about this, you know, I don't have the education in substance use or professional experience in substance use. I'll be very upfront with everybody, and I don't have any personal experience at all with this topic, but I do know how to research. I do know how to convene people. I do know how to get the information, prepare it for the Board of Supervisors, and support whatever it is that you need to know or want to do with that information. So that is something to discuss here. And I believe after we finish that, there may be some questions, and May has been kind enough to come today, that may be positioned or directed to her in terms of implications of the region and the new transition that the region's in its potential implications on the county. And I don't know if the Board of Supervisors have any other questions. So how do we start the bidding on this? Where do we start?
maybe some clarification, make sure I'm following you correctly, but I definitely want to hear the changes on the regional side. But right now, 100% of your time and effort is billed or goes to MHDS.
That is correct.
Okay. And so potentially by doing a percentage carve out, you would have salary and benefits that would be allocated towards, in your example, substance abuse that would come from that budget. Is that, am I following that
Correct.
correctly? Okay, and then some of your time would go that. So one of the questions I'd have then, and maybe it's a good time for May or others, is how does that affect the region? Is that normal and common that you go from, less than 100%? And then what, does anyone know what the future holds related to your types of positions?
May? Okay, so there is precedent within the region that coordinators have carve-outs of the time. And I don't know how many are 100%. I know they're very busy, especially in the smaller counties where they have to wear multiple hats. And so they're covering VA, they're covering general assistance, they're also covering direct service provision in addition to regional work. So there is precedence within the region. In terms of, I think one of the questions is, nothing on my plate from the region would go away. So essentially I would be improving my own efficiency in managing basically 4 days a week for regional work and 1 day a week for the county substance abuse work. I will, if this should take place, this would happen beginning in July 1st, which means I will have been in my chair for a year and 3 months. So enough time, I believe, for me to get my sea legs under me, going through at least a year and 3 months of regional business. Not to say that there's not things I can't still learn on the region. That's a lifelong learning goal, but especially with the additional help that the region has been helping me with doing some of the administrative assistant things, I believe that will continue to diminish over time just as a result of Jesselyn leaving and other regional resources and assets picking up for the moment. And then with a part-time 20-hour-a-week admin assistant, I think I'm well prepared to take on this kind of role.
A quick follow-up question, if it's related to budget, would they allow us, the region still allow us to bill 100% of your time? Or, so now we'd have a double hit, so it might be worth it. That would want, we'd be losing money from reimbursement from the region, and we'd be still paying 100% for salary, which no budget management would be twice the impact. Is that, following them, doing that right, Stella? I'm not saying this would be a deal killer, but is that how it would work?
Yeah, so currently, Ann Cameron's position is 100% reimbursed by the region. So by carving that out, we would get an 80% reimbursement on her salary and benefits. 20% would then be funded if she's working on general sup or on, substance abuse, that is paid for through general sup. So that's where that other 20% would go.
From a cash change point, it'd be twice though. So it would be, let's use 100 grand, so it's easy. And if it was 20%, it'd be 20 grand that one, we wouldn't be reimbursed, and then 20 grand that we'd be paying cash for out of the same fund. So it'd be cash, the cash loss would be close to 40 grand.
Yeah.
Okay. As opposed to if you were 100%.
I'm rethinking that.
Can you do the math on my?
I don't want to belabor the point deeply, but it's, if we're not allowed to bill you at 100%, you lose that reimbursement.
Yes.
And cash is not coming from here, it's coming from our other fund.
Yes.
Anyway, so, it's not like I said, deal killer, just,
Well-
that's one of the downfalls, whereas opposed to if we kept the reimbursement and just added a position.
Correct.
Yes,
the other option that is potential is that you could build your ARPA money for this.
Oh, yeah, that's-
So it's not necessarily in it, you know, the county wouldn't necessarily be eating that. It would be coming from that increased federal funds that you're getting totally legally because it's about. So it's
So fortunate to have a lot of pockets that are full.
for a couple of years at least, right?
They've been full for quite a while since I've been in the seat. So what would the 75,000 to 100,000 for substance abuse, using examples, will spend that in the past? And or any vision of what we spend it in the future if we increase it?
Sure. So my office handles the monthly claims for substance use commitments. And that is a combination of legal fees. It's also a combination of legal fees and evaluations from local providers. Right now, the county does not pay for any additional services or prevention. I'm looking at those monies and seeing, you know, if there's a way that the county could do a little more in those areas, it could implicate some measurable decreases in system loads in our law enforcement, in our hospitals, in our in our current substance abuse providers. We know we're strapped for staff out here. We know it's months before you can get in. If there's some numbers in terms of when you invest in prevention, it really does, there's a really good ratio return on investment from prevention efforts. So perhaps some of that money could be used for some prevention efforts. Could it be used? Perhaps. This morning we were listening to Hillcrest and their plans for the upstairs and the elevator, which you funded. You know, could some of that money go to support a sobering unit, a detox unit, something else? We heard today that there's really not a lot of resources in terms of substance use. So I think, you know, rather than, I've got some ideas, but they are raw and they are untested, and they would really need to have some experts at the table to consider what might be a good investment for the county. The other thing is I mentioned is, you know, it wouldn't hurt me to go to a conference or two to sharpen up my knowledge and connections and understanding of systems and funding systems and best practices and innovative approaches in smaller rural settings. It would not hurt for me to benefit from some of those things. Those have a cost to them as well. So that's the initial thinking on just doing a little increase to see what we could come up with.
Okay, thank you.
Mhm. Yeah.
I also want to point out, although we don't know the amount or when, we'll likely be getting monies from the National Opioid Settlement to do substance abuse work, prevention and services. So the thought of potentially convening and seeing what kind of things the county could do that could really benefit us when that money comes to fruition, if and when that happens.
So just to be clear, Ann, the 75,000 is what we put in the account now that pays for when the sheriff's office takes somebody up to the hospital. The county pays for the attorney for them and all that. And we haven't spent that 75,000.
Correct.
That's hard to believe, but
I believe our expenditure is under 20,000 on that. It's half of it. I mean, for this part of the year, it's under, so
well,
there's plenty of need out there, and to have money that's staying on the line when we've got people hurting.
and this is for the number of commitments that I've done through the years. It seems hard to believe that money would have been just used up.
Right, right.
But I think Harley, I think on those claims, honestly, I think some of it was charged out as mental health and some is charged out as substance use disorder. So,
Right.
you know, when when we're signing those claims, you see those split outs sometimes, like what's charge there. It's only the legal fees for this involuntary substance use that are straight billed out of this account. But, you know, I certainly, I think we've seen this need grow right along with the brain health issues grow. And I think that carving out 20% of Ann's time is, and I'd like to see it formally include education, Ann. I don't want to be ambiguous about that. I think that we should put funding in this for you to have those educational pieces as well. I would like to have the county really do some good work in this area. That doesn't mean that the county is opening up residential treatment. It just means that we're, you know, kind of pulling back the curtain and taking a look to see what works in the county and what doesn't. And that certainly was an intended part of hiring a director of this department. When we look at co-occurring disorders, we can have, you know, physical disability, intellectual disability, mental health disability, and then of course also substance use disorder. So they can all are frequently in some combination co-occurring. And this is just recognizing that right now the Iowa Code does not allow us to use same funding streams. It's and as you and I've talked, some of the same folks you're going to talk to are people who were in the room this morning. But when you have funding from the county to pay your wages from substance use, then you can have a full conversation that includes all the spectrums. So I think it's an important piece of work. And you know, May, you can address when you think that there might be the state actually recognizing that these are how people tend to treat their brain health issues, whether they treat it with substance use or alcohol. It's all part of the same, many times the same presenting disorder. But the state is not likely to be there this year nor next. I think that when we were talking, you thought it would probably be 3 to 4 years down the road.
So what is the future for your position?
Does the state or the region have a statement
Related to how the counties are interacting with the state region systems?
I think that would be a great conversation to have with May.
That's what I'm here.
Could
Can you speak to that? Do you have any insight?
I could tell you, but she's got the good.
Trust you both.
Good afternoon. The Department of Human Services has been very clear with us that the funding that is being appropriated by the state legislator for the state mental health and disability service system is passing through, if you will, the Department of Human Services. They have been very clear that they are funding our management plan. So if it says in our management plan, which it is required to by law, that we have a coordinator for every county, they're funding that. So I have not seen any interest on the part of the Department of Human Services or any action by them or the legislator for anything to change that way as far as employability. There are some regions who are thinking about different arrangements. Right now, the East Central Regional Governing Board has chosen not to make any changes as far as how our employees are structured and how they are funded. So, and the department has been clear that they're not going to intervene in that. So by law, we have to have a coordinator for disability services assigned to every county. By law, we're not required to have one in every county because some regions don't. Some have a coordinator that maybe covers 2 counties, but with the size of our region, we have a coordinator in every county.
Is there a requirement of percentage of time? So that's more
No.
of our conversation.
No, there's not, which is why some regions maybe share, you know, one coordinator is 50% one county, 50% another county, you know, they do that because there is no requirement of time. We are required to have a coordinator of disability services assigned to every county. That's about as far as it goes.
So if we went to 80%, that would be fine. If we went to 50, that would be fine, whatever
I don't know if I'd be fine with 50% because I think I need Ann's time more than that for contracting.
That was what I was
But
gonna get at.
legally,
Who
yes.
makes that decision?
Yeah.
Is that a regional decision?
Yes.
Okay. All right, good enough. Thank you.
Yeah. Do you have other questions about the transition while I'm standing up here?
transition
wanna
from,
tell us?
the transition from state funding or from local property taxes to state funding. So on Thursday of this week, when we have the regional governing board meeting, we'll be asking the regional governing board to approve a memorandum of understanding that the regional governing board, the region will sign with each county, which spells out how we will pay for the administrative expenses in every county now that you will no longer have a Fund 10. And all of the expenses need to come out of Fund 1. Yeah. Fund 1. And so you know this, and I know Stella has walked you through this, but we have procedures in place. We were very intentional that we don't want the counties to feel like they're floating the region, that you're paying salaries and then you get the reimbursement later, which is what the previous arrangement had been. So previously, Dubuque County would pay all the expenses that were reimbursed by the region, and at the end of the quarter, submit a reimbursement request to the region. Beginning in FY23, we're going to flip that system. So the region will provide a quarter's worth of expenses to Dubuque County prior to the first of the month. So it'll be in June and September and December and March, February. So each quarter, a quarter's worth of payment will come to the county, will be in the county account prior to the first day of the quarter. So because, for example, and I don't know, in Dubuque County, I haven't even looked that far ahead, but in other counties, they have payroll on July 1st this year. So we need to get the money to the counties right away before the first of the quarter so that they can do that payroll. So all of that will go to the county ahead of time rather than afterwards. Each county will still do a quarterly report just for us to look at reconciliation. We won't do any specific reconciliation as far as any transfer of funds either way until the fourth quarter, because otherwise we'll just chase our tail all year long. So we'll just do a report to ensure that the amount that is forwarded to the county prior to the first day of the quarter is the amount that is spent, give or take, and then we'll reconcile that in the fourth quarter. So in the memorandum of understanding as well, we have for every county their employees and what % of their employee time is funded by the region. So as Ann said, there's a precedent. There are other counties that have coordinators who maybe spend 90% or 80% of their time on regional work and 10% on county assigned work. So we'll have that spelled out in the MOU as well so that we can keep track of that. The state says for any employee who is not 100% funded by the region, a hybrid employee, that time studies should be done. And we put in the MOU at a minimum of twice a year, just to ensure, this 20% or this 15% or whatever that the county is paying protects us both, right? That we know for sure that that is the correct percentage of that person's time. We'll have the opportunity, of course, to reconcile in the fourth quarter and perhaps change the MOU if that percent is off for the next fiscal year. It's been a fun learning experience. I know Stella would agree.
Anything further, Jay?
No.
Okay, awesome, thanks. And
Anything?
I guess I'm just wondering if we have consensus on the request to carve out Ann's time.
I don't have an issue with it. I believe it'd be justified.
I think it's a good idea. The concept of going beyond 100% sometimes is a little fuzzy. So if you're still going to do exactly the same thing you do now, but now you're going to do substance abuse, are you working overtime? Is that an undue burden on you? You know, the region is right here and so is the county. So it's all about board. All you're talking about is a math equation here versus what's really going to happen.
I'll let Ann answer the question about burden, but I wanted to add to this, we just did just did a really big review of our clerical support region-wide. And we looked at, are we overstaffed? Are we understaffed in the region? And a lot of that was, the impetus behind it was Jesselyn's departure. And so Ann and I talked, and Ann talked with a few of the other coordinators in the region, and we decided for this fiscal year to not replace Jesselyn, because we have essentially farmed out some of those responsibilities to other clerical staff across the region who had the time and the experience and the knowledge to take some of the burden off of Ann. However, right now, I would say with the learning curve, and she will tell you as well, the learning curve that she's gone through in the last few months and the things that she's doing now, I would say I don't have 20% of her time to spare, right? Like if you said we wanted to do this March 1st or February 1st, I would hesitate a little bit because I know how hard she's working doing some of that stuff. We have farmed out some of that clerical stuff to other counties, but she's still doing a lot. This is why the recommendation to put a clerical staff in part-time for her beginning in July will be able to free up some of that stuff that she's doing now that could possibly be shifted to clerical staff. You can talk about burden. Well, you can see I've pulled my hair out since Jesselyn left, but it's all good. In terms of, I think, Jay, I think specificity is the key here. I would say that if this is the wishes of the Board of Supervisors to take a chance and do this work for the next year, that I present to you a very specific work plan with some deliverables that I believe that I can do successfully and in high quality, in addition to the work that I need to do maintain high quality standards for the region. And then next year we can have this meeting again and I can report out, is it too much? I just can't imagine that for what we're talking about, doing some really exploration. I think that's well manageable in the scope of what I do. Anyway, as Supervisor McDonough mentioned, I'm talking to the same people. Right now, I just can't talk about substance use issues. So it is sort of an artificial, like, don't go there. But it is going to be a new set of work, and it is in addition to what the position as it sits right now. And I don't know how the county handles that.
Are you, is that something you're seeking out?
Well, one of the
What I
questions.
don't want to do is assign you this. I want this to be you saying you want to do this. I think it's, I work with grants a lot, and so I know exactly about the time allocation, the percentage, and how that can be challenging. So, I would want to make sure that you're comfortable for this challenge, and this is something that you're seeking out. You don't have to answer today. It's not a, final decision moment, but from my vantage point, if you are 100% the region right now, and we're going to change your percentage to be another percentage, I would feel or think it would need to be your passion and or your direction.
Well, I can't answer that right now. I've had a lot of time to think about this. Probably over the last 6 months, we started talking about this. It's a need of the county. And so many of the people that we're talking about have co-occurring mental health disorders along with substance use. Our law enforcement are drowning in some of these cases, the hospitals. There's really never, waiting for the most convenient time in a life to take on something is might not ever happen. I think the time is ripe right now. I'm willing to take this on. I'm excited about it. I'd like to bring home the best product for the Board of Supervisors and to bring benefit to the people of Dubuque County. And who knows where this is going to lead to with the region, with public health and DHS merging eventually. That's the direction. So we could also be setting ourselves up to already be on top of the game that hasn't even begun yet. And that's a likelihood. It's not set in stone yet, but I'm excited to do this. I would like to get the permission today from the Board of Supervisors, or whenever it is you're going to make your decision. But I would like your support on this and for the budget, if that's the right way to go about asking today what I need.
It is for me. So if you're game, I'm happy to support it.
Thanks, Jay.
I'm
Supervisor.
happy to support it also, but I don't want you burning yourself out. A year's a long time to try to do this. If you're getting buried right away, come back and ask for help or something.
Okay,
Don't, you're doing an amazing job. I don't want to lose you.
thanks Supervisor Potter. I promise to do that.
And I would just, I want to remind my colleagues, this was part of the job description. And it was part of the conversation that we were having with co-occurring disorders. So it was there. May and I have talked about this for more than a year. And Ann, you and I and May have talked about this many times. It got serious as it got close to budget time. So, but the question's been asked of you. I think you have the skills for this, and I appreciate very much your eagerness to take on another element of lifelong learning.
Thank you. There's no other questions. I will
I have
thank
nothing.
thank you so much for your time and your interest and your good advice. I appreciate it.
Thank you, Ann. Thank you.
Well
Ann.
done, Ann. Thank you both. May, appreciate you being here.
Thank you, May and AC. Should we take maybe a 5-minute recess and get set up with Nathan coming in, I think?
Okay, motion to recess for 5 minutes?
Okay, thank you.
Have a motion to
Second.
recess for 5 minutes, Ann?
Yeah, second.
Have a motion and a second to recess for 5 minutes. All in favor signify by aye.
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 Aye. We're in recess till 20 after. Call the Board of Supervisors back into session. Next work session will be with the IT department. Nathan Gilmore.
Good afternoon, everyone, Board of Supervisors, people in Zoom, people in the room. I am excited to present some proposals using the Rescue Act funds. Some of this stuff has been talked about for a couple months. I think it's great that we can get it out and discuss and kick it around. If it's all right with the board, I prefer to start with the ARPA stuff first and then do the bread and butter budget after, but I can certainly reverse if needed.
Since you asked, for the record, I was hoping to do external ARPA funds before we did internal ones, but I believe my colleagues are saying move forward.
I thought we were doing external first too, but
I think this was kind of determined by Stella and how she set up the budget. So I think all of it's great. So I'm excited, Nathan, to hear what you have to say.
Okay.
good.
All right, so I'm starting with a pretty picture. It's aspirational. It is the idea of having a robust middle mile system throughout the county. However, I want to start with intentionally something a little bit more human, digital equity. Many of you have heard this. Many of you may have in passing, but I don't know if how many are aware of the undercurrent that this is building across this country and also across the globe. It has always been the case, but COVID brought this to the forefront in a glaring, uncomfortable manner. It is not surfing the net. It is not playing Xbox at 3 a.m. It is being able to participate in society fully, to be able to participate in government, to access healthcare, access education opportunities. And COVID, in a very abrupt way, showed how unequitable access to broadband is in this country. And government should play a role in helping to smooth that out, to promote competition, to promote cost reduction and accessibility. So there's two questions that I think the Board of Supervisors need to ask as part of this concept. Does the Board of Supervisors want to take an active role in promoting and stimulating broadband across Dubuque County? Yes or no? If the answer is yes, middle mile is a path towards that goal. Conduit comes in a couple of different forms. You have long haul, which surprisingly enough, there's not actually a lot of long haul in this country. When you look at the maps, and the maps are hard to find, they're not advertised, but when you find the maps, that is large conduit, multiple 4, 5, 6 inches that connect major cities. So New York to Chicago, Chicago to, Phoenix, Arizona. Those are what they are. Facebook, Google, DOD use those kinds of things. Middle mile is the step below that. And middle mile, generally speaking, is within a county. Sometimes it can go across 2 or 3 counties, but it's smaller. It's meant to connect the local anchor institutions, the local internet providers. And then the last piece is last mile. And I think that's self-explanatory. It goes to your house. It goes to the apartment building, to the school. So some of this is being done now. it's just not being done in a way that promotes broadband in a digital equity way. If you're a private contractor and you want to drop 20 million, you can. You can call up Anthony, you can get the permits, put in conduit, and do your thing. And that sort of works, but not really, because that's resulting in what we have now, which is deserts of broadband or areas that are locked out because they can discriminate about who they lease conduit or fiber to. That's their right, it's private sector, but they don't own the land. Like they're not, I don't think anyone would actually say if they bought all that land, anyone's gonna say, you know, you shouldn't be doing that, but they don't. They're using public land. They're using public right of way for that. So government can help level the playing field. It can put in conduit that is open. Any qualified partner, any qualified institution, any qualified internet provider can then go to the county or city or township or whoever does this sort of thing and negotiate either access to the fiber or more than likely access to the conduit. And the conduit that you'd be putting in would be something similar to this, where you have multiple ducts, you lay it once, county keeps one or two to assist our telecommunication needs. And then you've got 4, 5, 6 others, depending on what you're putting in, that you can lease out to anybody who has a need. And you don't discriminate. Like you're not going to lock out the second or third internet provider that needs to get through. If they want to lease it, they can lease it. So actually, let me go back one. Middle Mile has 3 primary customers or use cases. Anchor institutions. So let's say you built something similar to what I had on that first slide. It would be designed to kiss or touch anchor institutions that are not really ever going to go anywhere. So government buildings, healthcare, schools, things that in those communities are non-movable is really what the definition is. You either get right up against it, or depending on how it's designed, you might go in one side and out the other side for redundancy purposes. The second one is private contractors, private companies. So let's say you have a hospital and they have clinics out in the county. There would be interest in them leasing space in this middle mile system to connect their facilities up. It is unbelievably safer from a security perspective and from a management perspective if you have control of the wires in your network versus using someone else's network, especially when it comes to healthcare. And then the final one is internet providers. Internet providers want to get to the doorstep of a house. They want to get to the doorstep of a bank or a healthcare institution. You will work with them to lease space in the middle mile conduit, give them access to the handholds, and then they will do that last mile, mile and a half, 2 miles, or whatever it is to get from your middle mile infrastructure to their door.
Give us a quick example
Yeah.
of those internet providers you're talking about, and they're already providing internet, so how is this better?
So it depends on who we're talking about. If you've got a specific one that's out in the county right now, who would be part of this in the grand scheme of things, resiliency and redundancy. As great as telephone poles are, climate change is here, extreme weather is here, Duratio, Kentucky, this is going to happen more frequently. When that occurs, buried conduit is not affected. Floods do not affect buried conduit. Tornadoes, extreme weather, It's in the ground. It's fine. So if there are internet providers that currently have aerial, not saying they're going to lease everything that would be in this middle mile, but there are main arteries that would help augment their resiliency and redundancy options. And then the up and comers, hungry internet providers that are doing fiber to the home deployments right now in this county, in this city, those are individuals that you would want to seek out and help with the design of this.
Like I'm on MediaCom.
I'm going to try really hard not to name drop, but yes, those hungry smaller companies that are successfully doing it
Allow them
today.
to get to the market quicker, faster.
Yes, and in an equal capacity, because they're now going to be competing on the next person to come through on cost and quality, because the barriers to entry are going to be reduced for them. So if you fast forward 10 years from now, having multiple internet providers for remote workers is not a fictional idea. Okay, like obviously we're trying to get one right now. we're just trying to get one. But if you're a remote worker, like you're 100% remote, you're going to need a second internet provider because everybody goes down at some point. So that cost barrier, you know, bring the second person in, they'll be there. So there's value to middle mile from a lot of different ways. Obviously, we've talked about last mile from internet providers. We've talked about anchor institutions. But there's a lot of technology that's coming. And we need to get out in front of it in order to take this county forward in a future view perspective. So we have smart lighting systems. You're going to hear a lot about ITS, intelligent traffic systems. Obviously, we've talked about fiber to the home, but electric car charging stations, public Wi-Fi, flood, watershed monitoring stations. This stuff is coming. 5G is coming. And I'm going to talk a little bit more about 5G later, but the thing that is critical to understand about 5G, it has almost no range. It's wicked fast, but it only goes about 800 feet. So you need a lot of towers to do 5G, which means you need fiber going to every single one of those towers.
Which means it's going to be a long time before 5G is in a rural area like Dubuque County.
Unless we help with a middle mile conduit system, because a cell provider can absolutely lease space along that route. This is definitely a Field of Dreams inspired concept. If you build it, they will come. So. Okay, so I've talked a little bit about the perks. There's also traffic cameras. If hypothetically we did a middle mile conduit system, say along the Heritage Trail, that crosses like 9 or 10 different roads. All of that could have a traffic camera if there was a desire by law enforcement or the county engineer. Public Wi-Fi could be done anywhere along that route that made sense. Parking lots, campgrounds, gathering spaces, ride shares, all of that could then be achievable using that. So this is taken straight from the NACO Broadband Task Force that was completed in July of 21. These are direct copy paste quotes out of that report. It's a decent report. I would encourage anyone who has time to read it. It's linked in the downloads that I submitted. I was happy to see their very first bullet is open network. That means a middle mile conduit system that is owned and operated by a government entity is not going to discriminate. It is a digital road. It is a path. It is, we have this available. Come talk to us about business models and things that you want to accomplish. And so that is one of the things they're saying. It needs to be open. And anything like this that would be designed, I would hope that would be one of the key cornerstone platforms that it would be part of. They also talk about it being inefficient. So the crux of this is, if this is done, if Dubuque County wants to lead on this, we want to get everybody at the table who wants to participate. So we don't want to have other entities trying to parallel build another middle mile system. Is that truly a challenge in Dubuque County? Probably not, but we need to make sure that we get out ahead of that and not compete, but work with other entities that might also be thinking something like this. And then also just collaborate with all your internet providers, everyone. So we talked a little bit about anchor institutions, and I want to circle back around to it. This is a big deal because you can use these to help guide your design. So there's 21 cities in Dubuque County, or townships, or however you classify them. There's a lot of them. The location that they would help identify, we would talk to the leaders of those townships and cities and say, hey, we're going to come by. We're half a mile away using our normal route, but what if we pivot and swing by? Do we want to bring it to your city hall? Do we want to bring it to your city library? Do we want to bring it to your fire station? These are questions that we would talk to them early and see what makes the most sense. There's 22 county locations, not even including conservation. There's 20 more if you do conservation. We have a lot of locations, and I've got a map that we can look at and just kick around. Every single one of those could be a potential target for having this go by. We have 5 county libraries. I used to support 22 county libraries back, or 22 school libraries back in Missouri. I was fortunate that I only had 2 of those 22 having to go out over an ISDN. Everyone else, we had T1s and or direct fiber. You want them to be able to have direct connection with one another. Now, granted, the relationship with the county libraries is a little different here, but I can tell you from a networking perspective, if those 5 could have access, direct access to one another, it changes their game, because now they're paying for one internet bill, they're one firewall, one thing to manage versus the 5 that they have to deal with now. Western Dubuque schools, similar. We would talk to them early and say, hey, we're coming, we're in the design phases. What would the value of this be for you if we bring it near you, and then give you direct access to some of these locations that are in your district? Radio towers. We absolutely could run this by some of our radio towers too, and then also have fiber to back up the microwave links that are currently in that system, adding yet another layer of redundancy and resiliency to that system. And if we have conduit going to those towers, then there's the possibility of talking to a cell provider about potential leasing space on those towers. So this is just to let you know that while this might be a little new for Dubuque County, this concept is not new from a county perspective. This is, as of a few weeks ago, Summit County, Ohio, they're committing a tremendous amount of funding to build exactly what I am proposing here. Now, we have apples and oranges, we're talking different fund balances here, but this is a multi-generational investment. When they are finished with this, they are going to have enough connectivity throughout their county to be 80, 90 years before they have to start doing other stuff out there.
I gotta ask,
Mhm.
what's up with the map?
Shoot.
Sorry.
Okay.
I figured it was a little typo. That's fine.
I figured there was something coming.
I didn't know. I thought you were gonna say it's.
That's
size
amazing.
comparison to. Clinton
Did
County.
not catch that. Thank you,
All right.
NACO. This is a screenshot from their presentation.
All right.
Cool, cool, cool.
Most people probably, Iowa.
You know what?
That's, Idaho.
I truly did not even see that they had Iowa up there.
No worries.
All right, so, and this is my last formal slide on middle mile. Doesn't mean the conversation's over. This is just my stopping point for this. So there is money out there in the form of federal grants or state grants for these sorts of initiatives. Some of them are literally called middle mile by name. They're called out by name. So in the bill, bipartisan infrastructure legislation, it has a couple different names, but the thing that was signed back in November, there's $1 billion in that specifically for counties to apply for middle mile projects. That is the undercurrent that's coming. It's in the bill. Counties can apply for middle mile infrastructure. The guidance is not out. It won't be out until May or June. Most likely it's going to be a 70-30 or 60-40 split, some version of it. Almost every federal grant has a matching requirement. But we could apply for that. And it would be extremely helpful, in my opinion, if we had plans, if we had stuff already moving. We already had either designs in progress or we have commitments, because that's going to come soon. There's a reconnect grant. This might be a little fast. I don't know if we can do it this fast, but it closes February 22nd. There's money there that we could apply for. BEAD is the big pot of money. That's also in the bill. That goes to the states. Guidance is coming. Can be a little challenging because the state tends to, in my opinion, not necessarily spend broadband money the way I would be spending it to promote broadband, but it's there. We can apply for it. We can apply for it with partners. There's all kinds of ways we can do that. FAST Act is expired, but when you go back and look at it, every July for the last 6 years, this is announced. And it's a very fast turnaround time. They do the NOFA in July, and like end of August is when they close. So we'll be watching that. But again, that's something else we could take a swing at and apply for. So there is money out there. And that is something that if, again, I go back to question 1, if the board wishes to take an active role in promoting and stimulating broadband, then let's all in. Let's do it. Let's get, a plan, get some shovels in the ground, get experience, and start taking a swing at the pitches of some of these other grants. So that's the middle mile piece. And then I'm going to move on to dig once. Did we want to pause and have any questions more specifically, or are we good?
Maybe if you could just jump off to kind of some practical and or numbers without making us all dizzy. So, this phone, just on a plan, I might be able to get 5 megabits per second quick.
Yep.
If I go to a provider that has a shortwave to a tower, Kevin might know what I'm talking about, you might get 20 or 40 megabits per second. If I go to another provider in the city here that's claiming faster fiber, you can get a couple hundred, maybe even 1,000.
Yep.
What do we have here at the county is kind of our benchmark and fastest, and then what does this give us as far as speed, connectivity? You mentioned all the other things you're talking.
I'm going to take a very strong statement here that unless it's fiber to the home, it's not actually broadband. Because Fiber is the only technology that you can set it and forget it.
Fast internet.
It's
Yeah,
fast,
it's like,
but also the second piece, and this is nerd hat on, but it affects you. Latency. You can be fast and it can be slow. I know that's an oxymoron, but anytime you're only as fast as your slowest link, and when you're talking wireless, that's slow. You're gonna have a 30, 40, 50, 60 millisecond ping time. Even though you might be able to transfer a lot of traffic, you're gonna feel that sluggishness. Your responsiveness on video calls is going to be pokey because the latency is high. Fiber is the only, you're not gonna get lower latency than fiber. Like, it's just physics, it's speed of light. And you're gonna have unlimited growth speed. Now, let me clarify that. I can say that because the fiber that was buried 35, 40 years ago was started at 10 meg, then it went to 100 meg, then a gig, 10 gig, and now you can run 40 gig over the same stuff that was buried 35 years ago. It's the same fiber. What changes? The optics and electronics on either end. That is the choke point. That is the slow part. You change the optics, you change the equipment, which you're going to do every 10 years anyway, just because it's time to replace electronics. You're going to get a speed bump. The fiber that you're installing today, if you want to cut the check, I mean, granted, it's really expensive, but if you want to cut the check, you can do 400 gig over a pair of fiber. No one's doing that, but you can do it. If you want to cut the check, you can. So right now, gig synchronous, gig up, gig down, is sufficient for 99% of homes. I mean, even if you have 6 or 7 kids and everybody's streaming Netflix, you're going to be okay with a gig synchronous. 10 years from now, probably not. I mean, but again, fiber is the only one that is going to scale no matter what happens with technology over the next 50 years. And I will fall on my sword with that statement. I don't make a lot of declarative statements. So much of my world is subjective and gray. Fiber will scale for however long. And once it's in the ground, it's in the ground. Like, unless somebody takes a backhoe to it.
And they do that.
They do that, yes, which is why you want to design it properly. And as a ring, eventually, we have a long ways to go before we get to a ring. But if you do it properly and you build it as a ring, none of the customers know it got cut. Everybody who's monitoring it knows it got cut because you got alarm bells going off. But you won't know as a customer, which means you don't need to roll a truck at 3 a.m. in the dark to fix it. You can wait till the next morning and do it proper. And as a decent segue, if the Heritage Trail was picked as part of this design, the odds of that getting cut along the Heritage Trail is exceedingly remote because you don't have hardly any permits going across that trail. There's very little construction along it. It is a ideal path for conduit because it's just exceedingly rare that it's going to get cut along that trail just because there's just not construction along it, which is a selling point to people that you're leasing it to because you can get all the way across the county just on that run. And depending on what we talk to with Delaware County, you might be able to just keep right on going.
Yeah, you talk about all the federal and state grants. Where are you at to start? Because obviously, man, I know you, and if I give you a pot of gold today, you'd be back tomorrow asking for another one. So I need to know where you need to be to even start to apply for these federal grants that are for this.
So I would say millions, 4 to 5 million, allocating for middle mile would allow us to start, get the design. You could potentially do the entire Heritage Trail for 3 million. It's essentially about $150,000 per mile. Now, that's also fiber.
Lost me here. You said you needed 4 to 5 million, but you only need 3 million for the Heritage Trail, and that would be your link all the way across the county.
Correct. But if we want to take it down into Farley or take it into Centralia or have spurs off of the Heritage Trail. So let me jump out of this real quick and jump on my.
Or Dyersville, Costa.
Yeah, one of them.
Centralia is definitely on the list along with Graph, but.
Short jump to Graff. The trail.
The Graph is pretty short, you're right. Maybe that will be first. Can you get the city council to vote on that, Kevin? Graph?
So the yellow is the Heritage Trail. You've got Farley, you've got Centralia, you've got Piasta, not that far from it. You've got Durango. So what I'm saying is, if you allocated 5 million towards middle mile, we're not just going to suddenly go do Heritage Trail and these other things. We need to talk to our partners. We need to talk to the cities. We need to find out who may want to join us in this endeavor. And if they bring money in at the start of this, maybe they have better long-term rates. Maybe they have a 20-year lease instead of a 10. These are all things that are figured out as this is put together and then brought back to the board for obvious approval and vetting by legal and Anthony and conservation. As a rule of thumb, it's $150,000 per mile to do conduit and fiber. If you're just doing conduit, it's going to be cheaper because the fiber is the cheap part of this. But $150K per mile to do these sorts of builds. 5 million would get Heritage Trail or Old Highway Road, depending on how things unfold. And then also allow us to have spurs to come off to reach some of these population centers, some of these cities. And
hang with me right there. So the spurs, okay, so we can all envision Heritage Trail.
Yep.
And then a spur that boom hits Piasta or it goes to Dyersville.
Yep.
From there, the last bit, is it gonna run through your typical either cable installation? Is it gonna be satellite or short range communications? What, or be new wire buried? It obviously is not gonna be this to every home.
no, it would
So
be
what was
that last mile. So let's say we did this. This
Yeah.
again, this is a hypothetical.
You're
We
on
do this.
Dyersville, you're boom,
We're gonna
you're
go
on Dyersville.
south. We're gonna talk to Farley, find out if they have anchor institutions that are appropriate and want to have this bump up against it. But let's say we come straight south through Farley, all the way south, and we end up on whatever the county road is outside of the city limits of Farley. During that design process, we're going to talk to the internet providers and find out who is interested in bringing fiber to the home deployments in Farley and get them early in the process. So if they then need to do conduit or trenching or micro trenching, okay, because if you're just doing fiber to the home, you're not going to micro trench 6 miles, but you could micro trench half a mile or 3/4 of a mile to get from a meet me point at the middle mile to somebody's doorstep. So it's the last mile would be from an internet provider, someone. And we have several in Dubuque, and we have several that are interested in this concept.
And it actually would be fiber going to the home.
That would be something that I would strongly put into any sort of discounts we give them. We would want them to make certain you're bringing fiber to somebody's doorstep. You're bringing fiber to their door. We'd have to make sure we're not overstepping, but that's done. It is done in many other counties to where, no, if we're gonna give you early access to this build or a better lease rate, you're gonna do
Give my
fiber.
Last question then
Yeah.
on that, since we're hitting all the way to the home or to the business.
Mhm.
Can you give us some models or some comparison that we have enough homes, enough businesses or critical institutions. And we've identified some, but you know, when you get out there, you're really talking more about homes and, you know, a few good elementary schools and a bus garage and stuff. Is there enough that another provider would go, yeah, I'll pick that up because I know I can make money at each one of these homes? Or is it what we have today, which is a hodgepodge because we're not Chicago, New York, Denver, so and so, Orlando, so on and so forth. You have a model, and you have to maybe answer the question, but is any other small towns doing that? So we run all the way out to Farley, you've got 1,000 homes and businesses. That's it.
Yep.
And every year we're gonna add another 20. That's pretty good. That's our state of play. Can that work financially for another provider?
It can work financially for providers providing that the barrier to entry is low enough. And what I mean by that is if we can help do some of the heavy lift, you're now downtown. Like you're downtown, you're through downtown. They are now not having to go, let's say their nearest connection is Epworth. They don't need to get from Epworth to Farley on their own dime. They're gonna pay us to lease conduit. And fiber's cheap. Fiber's cheap. So they're getting from Epworth to Farley, that's gonna be a rounding error for them. Then they're in Farley, they're gonna work directly with Farley, they're gonna work directly with the businesses to have a critical mass of interest of signups, knowing that this is coming.
And that cost model's similar to what they've been doing for 20, 30 years, where they're gonna bury the telephone line, they're gonna bury the cable line, and it's gonna go to the house. And that cost, the last, you know, hopefully not too many miles, is, we'll take that because we're gonna get, you know, $50 from every
Yep.
home.
And there is a business case of a first mover advantage,
Oh, yeah, sure.
all that kind of good stuff. So
All right, I'm buying it. I mean,
Yep.
I've obviously seen it with.
yeah, it's there.
I've seen it with the, you know, that thing called the phone.
Yep.
And or, you know, then that thing called the cable TV and.
And in ARPA, in the final rule that came out 2 weeks ago, okay, I've read that 400-page document multiple times over the last couple months. And they came out with the final rule 2 weeks ago. A couple cool changes, and I'll talk about that further but cybersecurity is now in there, which is great, yay. They specifically call out partnering with co-ops. They don't exclude you from partnering with anybody, but they literally have it called out. We encourage counties and cities and municipalities to work with co-ops for broadband deployment.
Like electrical co-ops, is that what you're referring to?
I'm just gonna keep it at co-ops.
You know, a few farm co-ops and then it's mostly electrical.
Okay, well, I wasn't aware of that, but there is a co-op that we know does fiber to the home deployments. I have had many conversations with this group, and I don't want to overpromise and I don't want to put them in a bad spot here, but they are interested in providing fiber to the home deployments to non-electrical customers.
Sure.
So how do we help them and also help anybody else who may want to? Okay, we don't want to exclude anybody. This is an open conduit system. If there are other fiber to the home providers that wish to compete, bring it on. But there is value in working with a co-op because a business model is different. They can get a 25-year payback versus most private sectors are trying to do a 3 to 4 year payback. So it kind of changes the game a little bit there.
All right, I'll hit you with one more. And if it's concrete, let me know if you can't hit it. So I'm on one of those co-op sites, and for basically $90, you can get a gig or 1,000 megabits per second. That's speed, blah,
Yep.
blah. Having fiber, if there's an example out there, to that home does what for your cost and what for your speed? Hypothetically. So right now it's, you know, I can get 1,000 megabytes
Yep.
for $90. It's right here in front of me. assuming I'm in their coverage area, which I am not.
Okay.
So I'm using satellites in my house. So, I mean, is it, you get 10 times the speed for half the cost? I mean, roughly, or what, you know, what's that consumer gain?
So couple things. Latency, we go back to latency. You're only as fast as your slowest link. And granted, low Earth satellites are a lot better than HughesNet, which was in high Earth orbit. So you got a latency issue. And I'm gonna super nerd out on you here.
No. So no, I'm looking for, you know, is there a trend where, you know, you can get the same speed or, you know, 10 times the speed for half the cost? Or at the end of the day, is it, you know, it's still gonna be, you know, 50 or $100 a month?
Probably one of those where you get 10 times the speed for 3 times the cost.
That, well, potentially, if you could do that.
Yeah, I go back to my original statement. Fiber is the only thing that's going to scale for all technology over the next 50 years.
Your cost per speed certainly is gonna continue to come down. So you'll get more value.
Get more value.
For a
Yes.
same cost or less cost, hopefully in the future. Okay,
Yes, you will.
good enough.
Okay.
I got you. I'm with you. I am a little skeptical of the economies of scale.
Yep.
And how, you know, I'd love to deliver all this to all those towns you mentioned, but keep in mind, literally some of the times you mentioned, the auditor can tell you that there's less than 100 people that live there. And
Yep.
Granted, that's not true with Dyersville or, you know, Cascade or Piasta or Epworth. But still, you're not dealing with tens of thousands. You're still dealing with thousands.
And that is the problem. That is the crux of the problem,
Yeah,
because
we
the
don't have-
payback from a private sector or even from a co-op, I mean, trying to get that last 12 people that's at the end of a 1.5-mile county road, it's a 20-something year payback when you're getting $50, $60 a month. So there are challenges with that. And so this is helping to alleviate those challenges, to get digital equity, to get broadband to the people that are probably never going to get it in a reliable way unless there's a way to help in some capacity.
Good enough. Thank you.
Hi, Nathan, it's Ann on Zoom. I am enjoying your presentation tremendously and as always learning a bunch, and I appreciate that you delivered my my sample
Oh.
conduit to me. So thank you for someone making that drive out to me. I appreciate it. But you know, my question is similar to Harley's, and so it's really about next steps and how to go to get the funding opportunity. So if you want to go to the, you know, your next the next section, which is the dig once, I think. I'm assuming that at some point you're going to tie us into what your next steps would be, assuming we have some consensus on this.
Yeah. So let's hit dig once and then we can kind of bring that full circle to. Okay, so these are related, but they are not required, if that makes sense. There are synergies with these types of concepts, but you could in theory do middle mile and not do dig once. You could do dig once and not middle mile, but they definitely support one another. So dig once at its core is a very simple concept, but it can be difficult to do well, such as so much in life. At its core, it means when you open the ground, and you can be anyone, it could be a private sector, it could be a co-op, it could be government, it could be utility. When you open the ground, you are going to try to not reopen the ground in the future. And future can be whatever it is that you mean, 10 years, 15 years, 20 years, 5 years. The goal is to stop disrupting the right of way, to stop destroying the landscapes, and get as many people, entities, customers to all join in at the same time, get all of our stuff in there. whether we're competitors, whether they're partners, get it all in there, be done with it, and then move on. TJ has an amazing story with a sidewalk where his sidewalk was essentially dug up 3 times in a matter of 6 months because there's no dig once policy. Now, granted, we don't have sidewalks in the county, but it's a fun example. So this can take a lot of forms. All right, it doesn't have to be a carrot and stick. It doesn't have to be only sticks. It can be a lot more carrots. It is how you design it from a permitting process, from a partner standpoint, to where when we build a bridge, we should have conduit as part of that build, or we have handholds and we go under the river and do directional bore. So it's already there, ready and waiting. When we do a road, we need to have a conversation about, do we put conduit, middle mile conduit in as part of that build of the road? Yes, we might have islands to nowhere. That is a short-term heartburn of dig once. But those islands do eventually connect. And you go back to the point where you have to start somewhere and you have to build it before you can come. So ideally, even if the road is not a complete rebuild, we would be having these conversations about putting in middle mile conduit as part of that project. Even if the bridge is in the middle of nowhere, we would still want to put conduit as part of that design. When a permit is filed by a utility or a water company or something, we should have a choke point or a pinch point or some sort of take a breath. Have we done our due diligence and seen, does this make sense for the county to put their middle mile infrastructure in? And also, does it make sense to advertise this so others can, for a small fee, piggyback on them? Or is it shared cost among them? Again, there's a lot of ways to do this. There's no right way or wrong way. The question is, do you want to do this? And then what is the best solution for Dubuque County? From a zoning perspective, when you do a new subdivision, as part of that design and permitting process, do you want to require them to have fiber to the home ready conduit, flower pots and handholds as part of that subdivision design? My answer would be yes, you should require that as part of the new subdivision design, because then if we can help either directly or indirectly get a fiber provider to that subdivision, it's ready to go. Like, they'll be able to mobilize fiber to the home in that subdivision at fast and very low cost barrier entries, but only if you require it on the front end. Then they're micro trenching and they're digging up and doing other stuff. So if you're going to build it, let's do it right on the front end. So Federal Highway Administration, their definition: policies and practices that minimize the number and scale of excavations when installing telecommunications infrastructure in highways and right-of-way. Wow. It's basically the one sentence answer of what I'm saying. They're not telling you how to do it. They're saying you should take a breath, you should step back and come up with a process that minimizes the disturbance of the right-of-way. Every time you have somebody doing another permit to do stuff in the right-of-way, you're going to run the risk of bad things happening. And bad things doesn't even have to be fiber cut. It could be somebody hurt or killed. I mean, anytime you have construction workers working along. So the minimization of it is not just bolts, it's flesh. The Obama administration had a really large broadband opportunity council. I was super excited, and unfortunately, Congress never really funded it beyond lip service. But it was a really good document, and they had some really good ideas. And dig once is front and center in that findings. It's a good idea. Governments should lead on dig once. And local governments is where a lot of the permitting happens. Like we're it. I mean, we have the majority of the roads, we have the majority of the right of way. So it's us. I go back to the NACO Broadband Task Force. They talk about dig once frequently in there. They are really hoping and trying and advocating for a federal dig once policy that would then apply to states and cities. When I do a search on the bills, there's been a whole lot of dig once bills that make it through one branch of Congress, but they never make it to the other. I've seen them added to other bills and they're always stripped out. There's just not the courage to do that at the federal level, but it's gonna come, I think, in some form. So let's get out ahead of it and let's start doing this now as a county. There are more findings from the Broadband Task Force, strongly encouraging that anytime infrastructure is done, put in conduit. Again, even if we're not going to use it right away, we will someday. It's cheap when the trench is open. Like it's dirt cheap if somebody's doing an open trench. And I can use an example out at New Wine. I had a telecommunications company that was putting in fiber. I have a good relationship with them. For a very small amount of money, they pulled a second set of fiber or second set of conduit for us. Like it was dirt cheap because the machines that do this can pull more than one. And it worked out very, very well for the county. Okay, so from a dig once perspective, that's it in a nutshell. Like, do we want to do this as a county? Yes or no? If the answer is no, okay, cool. If the answer is yes, we're going to need some funding to fund Anthony now as he does designs and bridges and roads. We potentially will need some to work with CJ for outside counsel or however he wants to run it to build these documents. And then going forward, I would hope that we can fund it in a sustainable model so we don't miss opportunities.
Part of your construction improvements, do they include like pavement overlays? That's what we do a lot of. We do some reconstructions of roads that are, many of them are just overlays with, you know, very little change in the actual removal of earth.
Yep. Yeah.
So good. So you obviously have heavy equipment there, you have manpower there. And so you would say, okay, you're River City Paving, since they're our only paving contractor, we'll mention them. So you'd say, okay, you're gonna do these 3 miles. Here's the design specs to do 3 miles of conduit at the same time. And they might sub that out or they might do it themselves.
Yes.
That's what it is. Okay.
That's where this comes from. And that's a challenge. And Anthony and I have had a lot of conversations about that over the years because yeah, we don't destroy a lot of roads and build from the ground up. We do what you're saying. So the cost savings are not as high because we're not being so destructive with the road, we're overlaying it. But that's the premise. You bake it into the budget of the road and then we start advertising this. I didn't mention this at the start, but that's part of this. Middle mile, dig once. It's a public map. Telecoms, internet providers, they know this.
So if we do 10 structures as well, you do the structures and maybe you'll fan it out for 100 feet each end of the structure. Something like that. And so after you do that for a series of years, all your structures will have the conduit. And then when you go back and resurface that road, you connect it all the way down to where you stop resurfacing.
Bingo, exactly.
You do that for a decade and you got conduit all over the county.
That's the dream. Yeah, that's the dream. Anthony, are you online?
Yes, I am.
Is there anything you'd want to weigh in at this stage or?
I would just echo a lot of things that you're saying, Nathan. I would be a big proponent of dig once. If it's something that we can legally uphold, you know, we often get underground construction permits for, you know, it just seems like a patchwork of utilities throughout the county. And you know, if that's something that we could kind of get on top of going forward and sort of control the amount of times a particular right of way section is dug up, I'm a big supporter of that. I think, you know, with our construction projects, like you guys have been saying, we do a majority of our road projects as resurfacing projects. So it's not necessarily the same thing, same scope of work with the utility digs, but it's something we could easily add into the project, as you know, as long as we have the funding to support it.
So Anthony, this is Jay. What's your estimate on per mile or per foot cost for that, you know, trench basically to put in that? Do you have an idea?
I have not really figured that out yet, what that would be. I could tell you what we generally estimate for resurfacing projects, say for an asphalt project. I estimate around $340,000 per mile.
Okay, and how many miles have we been averaging in resurface and or reconstruction? Roughly about 30 a year? A little more?
Yeah, I'd say 25 to 30. 30 would be a probably pretty good year.
Yeah, so that's kind of what I'm getting at is, you know, if you have, you know, 25 miles a year and then you've got 10 structures, you just need to do the math, and that is the cost, the extra cost that the public is paying for this.
Yes.
Now, if you can get it through the federal government to, you know, pay that helps. But otherwise our, you know, our rural road use tax and our local option sales tax, that's what would be used to pay for this. Is that correct?
Yes, yeah. This is, in this instance, while we may have partners, because this is a public document, that public roadmap of construction projects, there's a potential we could have partners on the front end to help reduce the cost. But realistically, we would have future use conduit going in that's not going to be used that day. It would come later. So yes, as an idea, this is just a visual. This is all of Anthony's road projects from a year ago, this year, and then going forward. The blue and the orange are completed. They're done. That's not to say that we can't go back in time and put conduit in if we chose to. I mean, Swiss Valley Road would be really nice to do since we have assets out there. But going forward, this is kind of a visual of what we could do using what he's already planned to do from a Dig Once perspective. And then this is just our house. Dig Once is not just our house. Dig Once is also everybody who's asking for a permit in the public right of way. We need a process to evaluate, okay, you're going to do 1.5 miles or 2 miles of whatever it is that you're asking to do. To get that permit, you're going to have to also pull our middle mile conduit as part of that design.
So stay with me on that. So Anthony, if you're still on, I mean, so what are our estimates of pulling that middle mile per mile or per square foot? I mean, so you might be dealing with $75,000 to $100,000 per mile.
Mm-hmm. Potentially.
Multiply that times 25 and another 10 structures, you're talking about $3 to $4 million extra cost each year for the future, maybe. So
if we chose to do it on every single build,
yeah,
yes.
Agreed.
So,
but those would be our paved roads. So
mm-hmm.
you know, it's not including even, you know, all the granular surfaces out there. So anyway, my first thought is that each year, that's pretty pricey.
Mm-hmm.
I would rather have the Heritage Trail, boom, drop for 3 million than have scattered non-connecting fiber throughout the county, would be my quick take if you ask me to prioritize.
This is a slow burn build. Like this is a 3, 5, 7, 10-year process to get conduit in the ground. And also, keep the right of way as healthy and as safe as is reasonable. Like there's multiple components to dig once. It's not just that part, which is obviously a big part. So how we fund it, we got to figure that out. And we have ARPA funds. There's other funds that are from the budget. You know, we need to figure that piece out, but this is huge if done correctly over years time span.
Is anyone else in Iowa, Illinois, or Wisconsin doing this? Throw Minnesota or Missouri, Nebraska, South Dakota.
So the Iowa question, I have not found counties doing it in Iowa, with the exception 3 weeks ago, out of the blue, from the state OCIO office, they notified that they are doing a dig once notification for their state road projects going forward. I was a little bit in disbelief when I got it, but no, it's from the OCIO, and so
For me, it's not a barrier. Was asked that exact same question when I was selling technology for the last 30 years, various times. Yeah, it's just, I think when you look at pick a number, 2 to 4 million a year, and it's not planned. The roads are planned, but they have different uses and they're disconnected and or individual separate links. It gets really hard for me to follow the plan part of it to conclusion and benefit to the public within a period of time that's acceptable, 4 to 8 years, for example, I'll say. So that's what I'm struggling with. But I definitely like the other fiber part is more interesting for me, but the creating a new policy for dig once, and this is probably your 6th time you've kind of mentioned it. So I love it. I love your persistence. I have trouble with the cost benefit.
And I would counter that there's a lot of ways to do dig once, and we could potentially protect the right of way. If funding 2 to 3 million a year is too much, which it probably is, I mean, realistically, he's just doing the math. What is an acceptable number? And then what is the vision that would be acceptable for the board? Anthony, CJ, like, this has value, even if we aren't dropping millions every year. We would strategically target when it would occur. So I'll pick on Swiss Valley Road. Okay, obviously that's finished, it's done. But if we had this policy in place, we could have pre-funded that for Anthony and done our design. And we would now have conduit ready and waiting that we could have then hooked on Military Road when that was done. And now we're up at Southwest Arterial. So I'm not saying as a blanket statement that we do it on every single one, but a policy has value. And maybe that policy is Anthony brings to the board and says, you know, this would make sense for this build, or we've got Alliant doing a build in this right of way for 150 grand. They'll pull our conduit along with theirs, which that's all part of the policy. That's how we have to figure out what makes sense for Dubuque County.
And it goes back to, oh, sorry, go ahead, Ann.
No, Harley, go ahead.
It brings me back to what I had said earlier. It's, we have to have a starting point. I understand that. But again, if I give you a pot of gold, you'll be back tomorrow for another one.
Doesn't mean you have to give it to me.
No. And I can't justify $3 to $4 million extra in road use for this a year. That's high. I mean, something lower, like, you know, I don't know where you would be on that, but maybe up to $500,000 a year, maybe.
Mine would be more purposeful, not necessarily a budget, but more purposeful. So what I don't like about the concept is it's following a transportation roadmap, not a fiber to business and homes roadmap. Okay. And so having a policy where we're doing a road and it's directly connecting to more than a number, you know, 300 or 500 homes or businesses, now you have my interest. And so that's kind of more purposeful connection and more near time use is where I'd want, and that's why I voted against the Southwest Arterial piece. And so hopefully that gets connected and used next year. But if it's 5 years from now, most of my taxpayers are not gonna be real excited.
Okay.
They hear you, they hear your let's build it for the future, but I'm a general proponent of, you know, taxation and construction with near-term use. And so it doesn't line up when it's further out. We can't build roads to nowhere hoping a subdivision will be built. We don't do that. And for fiber, I think we have to follow a similar model. So would still support it, but it'd have to be connected to homes and businesses, with my 2 cents.
What are the, I guess, payback on this if we're leasing to somebody? We run Heritage Trail out across the county. What can we reasonably expect for a payback for a lease on that?
So if we follow the city of Dubuque's model, which they have been using for about 10 years now, they do $5 per foot for a 20-year lease. So payback is part of this. Don't get me wrong. I'm not blind to money. It's ideally ends up in a situation where
What was the dollar amount again?
$5
Thank you. Okay.
per foot for 20 years,
Got it.
forever.
20-year use.
Yeah, and whatever 20 years, I'm sure they bump it up 20% or whatever that is, but that's 20 years from now. So that's just raw conduit leasing of this, and
Roughly like a quarter a foot per year.
yeah, it's 25 cents a foot. You could,
If you did 26 miles on the Heritage Trail, and divide that or multiply that times 5,280, which is foot, linear foot, you take your $5. If somebody said, sounds good, sign me up for the whole Heritage Trail, that would be, and for 20 years, it'd be $686,000.
yep. Well, if you got multiple other leases, that's one leasee, but you'd have,
Times 5.
yeah, you'd have 5 more opportunities to lease.
Was that when I did 137 times 5 is $686,000 for that 20-year lease, and most likely they would amortize that, or you know, you may get all up front, or you know, they would probably loan it. But I mean, once again, if you had enough providers, and if there was, you know, Des Moines on the other end of the Heritage Trail, I think you'd have a slam dunk.
Right. I'm just,
Yeah, and there is value.
Hundreds of thousands you probably could generate.
So there's value in matching our partner, City of Dubuque. There's value in that because it's simple to explain. But they have much shorter runs than we do. Like, they're contained in this area. So however they came up with that $5 is how they came up with it. You know, we could charge less, we could charge more, because it's a continuous 26-mile run. I'm not saying this is not how we're going to figure this out today, but there is payback, there is value, and there's also public good. Again, some of this is government doing good work to promote broadband, digital equity. So just got to get one last plug there. So.
And it works. I mean, obviously it's been working.
Mhm.
There's telephone lines, there's cable lines, and it's been working. You know, so if you took that divided by 20 years, you'd have $34,000 annual cost. If you would just take, you know, one town, let's say you could get 400 homes, and if you could get $75 a month for each of those homes, $475, that's $30,000 times 12. You know, you've got $360,000 of annual revenue to offset that $34,000 cost. So that's how this has all worked over the years. We all know we pay phone bill, utility bill, so on and so forth. So but yeah, I think it could work, and it's certainly a role. I would just want to make it more purposeful, more to the people, to the businesses.
So to circle back, CJ or Anthony, before I circle back to my ask, do you want to weigh in anymore?
Yeah, sure, please, yeah.
Oh, yeah, you could. Yeah, you can sit there if you want.
Oh, perfect.
Yeah, we have the power now. Let's speak from there.
That's right, that's right.
Well, I only have to add is that for the last few months here, I know Nathan's been working really hard on this, and last couple of months he's asked for my input, just from a legal standpoint of, can we do this? What meaning does it have if it's a right of way or an easement? So we've been trying to resolve some of those issues. Obviously, until he has the ability to move forward, we don't have the definitive answers yet, but I certainly support his project. I think it's a great idea. It's a great forward thinking thing for the entirety of the community. So I will continue, if it moves forward, I'll continue to do my part from the county attorney standpoint.
Anthony?
Yeah, Nathan, I don't have, I guess much else to add. You've covered it really well. Like I said, I'm a big supporter of that dig once policy, and if the board directs us to, add this into our projects, that's something I can easily do as long as there's funding for that.
Okay. So
Maybe I could ask my questions.
of course.
Okay. So no one's talked about the equipment to do this ourselves. That was a discussion point and it's not been raised today. Is that another day, another discussion point, or was that explored and determined to be futile?
So we explored it, and I would not say it's futile. I would not call it dead. It was just, in my view, and Kevin, I don't think we were unable to get it to a point where we could present in a digestible manner for this. I think it still makes tons of sense. There's some union challenges that need to be worked through. The concept was increase Anthony's staff and do this in-house. Get the team, buy the equipment, buy the materials, and that is what they do. They do 40, 50 miles a year. He uses them for other duties as needed, snow removal, whatever, but their core functionality is to do it ourselves. I absolutely think it has legs. It is a complicated endeavor once we got bigger into it from a union issue and other challenges. So what could happen is, depending on if the board funds middle mile, if that you fund it at a level, we will continue that research, and we could absolutely pull it from that fund, the equipment purchases, and then work with the board and HR to figure out how we do a sustainable salary issue with that going forward. So yeah, I did not bring it up because we got to a point where it wasn't really going to be a thing that I felt that I could pitch as part of this. Kevin, or if you want to weigh in, please.
Yeah, I think a lot of the concerns that Supervisor Wickham brought up could be made a little bit less concerning if we were to look at doing this in-house. There is sort of an order of operations, and it largely depends on sort of what Nathan was talking about today, as far as the two questions that he has for the board. Where are we looking at for broadband? What level of investment do you want to do? Given that there are leasing opportunities for the ducts inside, Nathan and I and CJ and Anthony have had numerous conversations about what would it take to do that in-house, which reduces our barrier to entry by making the entire process entirely more cost efficient. Where Nathan and I think we arrived at was sort of seeing what the appetite of his initial proposals for the board was at. And then given that, given any investment by the county, we can then look towards ways to maximize the usage of those dollars. And by every metric that Nathan and I have looked at, if we were able to arrive at a way to do this internally, those dollars are spent much more efficiently by us being able to put it in the ground ourselves. And not to mention being able to do it in a timely manner, given that we're looking at years out to hire some of these companies to do this work.
Yeah, no, that sums it up beautifully. And it does flip the script because it means we now have direct tender loving care of the right of way. Like it's part of Anthony's crew, it's part of his shop, his universe, his people would be doing it. It makes us more nimble. We can move faster because we don't need to do a bid and we would do most of the design in house. So there's a lot of value for it. I absolutely would be interested in continuing that research, but yeah, where I kind of landed and with Kevin, and we've been having a lot of great conversations about this, is that, well, let's find out, does the board want to take an active role in middle mile? And then we can go from there, because no shovel is going to get in the ground tomorrow. Like we have a lot of work ahead of us. I mean, there, in addition to design and permitting and National Park Service approval process, and the materials are a long ways out. I mean, if you gave approval right now and I cut a PO tomorrow, it's this stuff, everybody's doing this. So I absolutely would enjoy continuing that research and thought experiment. So I'll just segue back to Supervisor McDonough if there's other questions you've got right now.
Right. So for me, at high level, this is a priority ARPA project for me. I've read everything. I've seen what we have in front of us from external, internal. This is a high project for me. Middle mile is important to me. The dig once, you said you have not found a county close to us that's doing this, or maybe even in the state. Obviously, we need to explore what the state's just declaring they're going to do. But I like the idea of doing a dig once that sets priorities and purpose. I think my colleague said that well. And I don't think we want to, the first person I'm going to talk to is not going to be the subdivision developer. We know from last week that the Builders Association has already been to the state capitol, and there was legislation introduced. Maybe it's not going anywhere, but by Shannon Lundgren and others, to say that we can't require our own water ordinances, our stormwater discharge ordinances, to be more onerous on a subdivision developer than the DNRs. So I think you can take from that the tone of, I'm going to use a fun word, a mandate on a new subdivision developer. So then the question is, if we're not willing to do that, or this isn't the time, not the current time, then what do we get? Even if we're only looking at our own county assets and our own county development as we do roads, I think this is the time. You don't distinguish Iowa very many ways, and you certainly don't distinguish our county very many ways when we look at workforce and all the high priorities. So something like the development of this type of programming where it can create a return on investment, it's looking ahead, it's thoughtful, it can be intentional, it doesn't have to be that pot of gold with another expectation. I think it can be budgeted, but I don't know why we don't want to pursue that. It's to me very high value. And I'm thinking of a person I've known for many years, and she lives out, well, it's not up off 52, but out in the Sherrill area in a subdivision where they have inability to have any kind of internet. They're putting up towers. It's just not happening. They're down in the valleys of Dubuque County, and depending upon what your trees are, it isn't the same. And we are winners and losers all over the place. So it doesn't have to be just equity by income. It can be equity by location and access, equal access. So to me, this is a high priority. I'm one vote, but you're in my top selection for how to spend this money that the federal government's given us. And my mantra would be, get ready. You need to get ready to be ready for the grants, right? So you've got to get grant ready. And whether we do 3 projects to be grant ready, or we do 4 or 2, but I really would strongly encourage us to get into this area in the capacity that we can find a number we're all comfortable with. But I would like to see you develop this more. And for me, our own teams doing this, I think is a tremendous cost savings. As you say, we have so many miles and we know we're going to be at this for a long term. It's not the city trying to get just a few more blocks, or the city of Asbury, you know, a few more miles. We have a long stretch to go, but I think we have, this is a very much forward thinking.
I would agree that I do think it's something that we need to move on. I do like the Heritage Trail thing. But after a lot of consideration, I think we might be better off going along Old Highway where, you know, you come from the fairgrounds, whatever. You're picking up the fairgrounds, the Southwest Arterial, then you're going through Centralia, you're pretty much right at Piasta, you're going through Epworth. You're not having all these excess branches coming off to get to the town, you're already at the town. Which would probably save quite a bit of money, and it affect a lot more people.
Generally would agree conceptually. What's the further most west access to fiber right now, when geographically coming out of Dubuque County from the river? What's the further most west? Is it the comm center? Is it?
So what are you talking from an internet provider or from our perspective?
Just a publicly accessible fiber, like the cities, most likely the cities. So
yeah, the city has their conduit system.
Where does that end on the west side of it? Where
it will end at the EOC very soon.
Okay,
they're coming.
So that'd be about.
And that's one of my projects for ARPA.
So Old 20 would be right there, hypothetically.
Really close.
So, yeah, I mean, the way I would look at it is just, you know, if you start with a project scope, you've got the ring, you've got kind of the vision. We've had great doses of that. I would try to break it down to more practical components after that, that hypothetically, doesn't have to be this, but since you mentioned it, from roughly the fairgrounds to Piasta. And then what would that cost look like? And then what would that, and have some service providers, like you mentioned, say, all right, so let's say we do that, what happens then? And if they all go, wow, we would look to get 300 or 500 homes and businesses signed up, and we would run the last fiber to every one of those homes and businesses. So now you got a plan and you got some momentum. And that's what I would be interested in funding as a, let's call it a pilot program.
Well, it's a,
because the last mile would realistically take it from Old Highway Road into Piasta, right?
Yeah, and that's where either, you know, the city Piasta takes that over, and or then a service provider takes it to the rest of the businesses and homes, and you've got your first of opportunity of 200 to 400 to 500 connections.
And Anthony, can you please answer this question? But isn't Old Highway Road on your next big step? Isn't that a next big project?
It is from the fairgrounds.
Yeah, yes, in 2 years, we're going to be resurfacing Old Highway all the way from Seipel to Farley.
I can thank Supervisor McDonough when I first talked to you a couple months ago. Very similar to what you're all talking about right now. You suggested to me hit the cities. So as a hypothetical, this is a concept, 100 miles basically. This is the Heritage Trail. And this is coming through some of our cities and townships. So Farley, Centralia, Piasta, not all of them, but quite a few. So again, this is a visual concept, but this literally would be 100 miles. That gets us the Heritage Trail. That gets us a really good north to south trunk. And then these phases are arbitrary. These phases are just like came up with. But this would be approximately $150,000 per mile. if you wanted to do this, but it's also broken up in phases. So again, but let me take a step back. It's super fun to play with maps and Google Earth and all this. Like, it's super fun. And I will do this for an hour, 2 hours with you nonstop if you let me. But we're getting out ahead of ourselves, because let me bring this full circle. Does the board wish to take an active role in promoting broadband throughout the county? And by broadband, I mean fiber to the home deployments. Yes or no? If the answer is yes, what is the allocation amount that the Board of Supervisors is open to allocating for that initiative? So yes, no, and then what is the number? And the number will dictate what we can do. And we will do what the board helps us craft as a vision. Like, this is not Nathan just, saying, okay, you're gonna get a conduit. That's not this. This is Anthony, CJ, me, the mayors, the internet providers. We're gonna get everybody in the tent and help us build the best bang for the buck using the funds allocated. But this sort of thing is achievable. Now, we don't have rings, but rings can come over time as we then connect these sections to one another. And Supervisor McDonough, you said, skip the rings, let's get conduit in the ground. So yes, this is a good stab towards something like that. So, I have the original premise I had in the proposal was 7.5 million for middle mile. I had 2 million for dig once. Given the adjustments in dig once based on board feedback, 2 million might be a little high. The goal was to get enough resources to come up and craft a policy that will work for Dubuque County, and then pre-fund some of Anthony's projects. I don't know the answer. I mean, that's what I proposed. It's what is the board willing to allocate? And I know this is obvious, but let me make sure people on Zoom know. Allocation doesn't mean spend. Allocation means allocate, where you need to come back with plans and design docs and proposals, and then chunk this out into manageable pieces. Like, this is a huge undertaking. It's not going to just be, a month from now, we have millions of dollars of bids to go out.
Well, I can go first, Nathan, so you can see where I am in my budgeting. I know that there's preliminary steps. You and I've talked about, you need to get a plan for a plan, and plans cost money too, right? So
Yes.
there's steps to go in this, but I am very thoughtfully interested in giving you a $5 million budget to look at this, to show me on paper what this would look like if you were going to spend 5 million.
Okay.
So, is that enough to bring it all home? Nope. But I think you can tell that I'm serious about the dollars that it takes to get us a plan that becomes actionable. But in that also, I would like to see there be, and this may be for Anthony, but where are we with equipment purchases? Can we put some of those things into his budget? And, so there's a lot of people weighing in on this. But to me, this is, for ARPA funding, I wanted really good ideas that are change ideas that you can say, this is what we're doing. And I think that's what you've brought, and I appreciate that very much.
May I ask, 5 million for both initiatives, or is there a second number that you would want to allocate towards dig once?
Harley, here he is with that second pot of gold request, right?
Nathan,
He's gonna quit saying.
just got 5 million to say thank you. Is there a second to that? We'll coach you a little later. That's a hypothetical.
Fair.
I love what you do. I'm glad you have the application, but I don't, and it's not anything you did or the, scheduling, but we went out to the community and asked for, applications and a survey for ARPA funds. And this is the first time we're talking, the first time anyone's thrown out a number, they'll support it. And, that's good. We're elected officials. We have an opinion. We can say what we want to support. But I think we need to go back to the other ones before we start doing internal. So that's my first caveat. So I'm not going to say, yeah, go forward. But generally speaking, if I was to, lay this out, I like the ideas Supervisor Potoff has along Highway 20, and maybe when you get to Farley, use the Heritage Trail to get to Dyersville, hybrid method, and use the pilot project. And maybe if we're doing Highway 20 and it's on 2 years from now, we try to lock that in. And then my last point, since it's been mentioned quite a few times, I have no interest in getting a team or employees to do this. We don't build our own bridges. We don't even pave our own roads. I just don't think that's the business we should move to. We pave some roads, we do culvert work, but I don't think we need to create a new core expertise within the county for doing this. I think we support the private sector to do that. But I'm open to this, and I have been open to this. It's just I would like to give a little more time and priority to our external applicants who put these in September 15th, and we are sitting on them. That's not good. We need to get to those. And then we need to give you and your other department colleagues an answer as well.
As I said, I definitely believe this has legs and we can move forward on it. Obviously, we're a long ways from that, but I would suggest you look into, the old 20 route, along there, that you're a lot closer to the towns. Like Jay said, we get to Farley, okay, then we can jump down the Heritage Trail and run into Dyersville. Something to that effect. But I would like it broke down, Ann's 5 million would roughly do 30 miles,
Yep.
So that's going to get you there no matter which route. I don't know if I'm at the 5 million mark, but we have to go through these other applications to see what we have available.
And
There's a lot of people looking for money.
Oh, absolutely. I get it. And I'm not, if the board wants to give a yes today, amazing, but I'm not expecting that. But there's only so far we can go down this path until we have a number to work with, because that number then dictates how grand are we going to design this with partners and stakeholders. So yes, I can get maps out and start revising what's in front of you to do that. But at the end of the day, we're going to need a number at some point in the next few weeks here to be able to then go to our partners and start getting more stakeholders in the room to get this formalized.
Yeah, but I think it needs to be broke down into smaller sections, like Jay said, from the fairgrounds out to Piasta. Okay, what's it going to cost to get us to Piasta, and how much interest do we have? How much more to get to Epworth? How much more to get to Farley? And how much interest we have in these other partners to jump in on this?
My only hesitation on that is it's easier to talk to partners when we know we're doing it. What we're doing, we can change and flux, but it's harder to have serious conversations with mayors and internet providers when it's not confirmed that we're doing it. So,
well, maybe I'll read the room and feel free to comment, or everyone be quiet. So it sounds like you have one willing partner and you need to sell another one to get this done. Guess what? You're in the same boat as 50 other people for applications. So I wouldn't keep saying, I want to know what number it is. I would try to convince and listen to your, decision makers here, what they're asking for you. And so I'm asking for smaller bite-sized projects, and I think my colleague as well. And, I'm going to weigh that against some other proposals that are very good, totally non-technology, that involve social services and involve the healthcare industry and a whole bunch of other ARPA funds.
Okay.
And the good news is we haven't spent $1. So it's all there. You just have to figure out how to prioritize it.
And what I would say, Nathan, is that the mayors that I've spoken to, I mean, and even in last spring when we were talking about this, are very interested. They like that we're talking about helping them get connectivity and that they can do you know, residential development and business development, that these are good things. But also, you know, the old, well, I'm going to use Crudgeon, but my old engineers who have an understanding that this is the modern way you build roads and you put your infrastructure in. This isn't like a surprise, at least that's not my test run of this with folks. They would want us to be doing this as we put down the roads, that this is a necessity to make modern infrastructure. This is modern technology and it's modern connectiveness. So, you know, I guess that's the reason that I'm at the bigger number, and that's where I am. I'm ready to go on this. It's high need, and you know, it's not like it's just me dreaming. It's been sound tested with folks.
Move on. Okay, all right, so there are two ARPA projects that are related to the EOC. The first one is very important to the future of our connectivity out to West Campus and EOC. So I've been mentioning this for several years to get us off the INET, and the city has been building infrastructure, fiber, conduit, and they have made us an offer that is incredibly kind. And I due diligence where it is, it's kind. They know we have a need. They know we've been trying to get out there. For $100,000 of improvements to the EOC. And that will be in agreement with Tom Berger, with city, with you, with us. We don't need to get into the details of that level. Just, it could be a generator, it could be security cameras, just improvement to the building. They will give us 48 pair of fiber from a future meet me point, which is about 2 blocks from here, out to the EOC forever for indemnity rights usage. So from a value perspective,
For how much?
100 grand
Okay.
forever, 48 pair from downtown here out to the EOC, upgrades to the EOC that we all agree on that are needed. That is the offer. I strongly encourage us, the board, to bite on that so we can begin getting the necessary other things to get from the courthouse to the meet me and other things. But from a network standpoint, that will manage all of our needs for the next 20, 30 years. We're not going to need more than 48 pair from here to the EOC.
And then hypothetically, that could be our starting point from the EOC to Yosta.
Yes, well, there's other stuff I got coming that, yes, to bring more conduit and
That would
fiber
be the
into West
furthest
Campus.
west. That's kind of what I
Yes,
was getting at.
we
That
would,
would be the furthest
yes,
west.
it would be the furthest west that we go with our fiber that we own and control.
Yeah, cool.
And again, it's not going to be willy-nilly. It'll be a collaborative group effort to inject some upgrades to that building. This next one is mine that I am proposing. And I know that's a huge number, but you know what? I've done a lot of AV in the last 3 years, and good AV is expensive. The AV out of the EOC is subpar, and I'm not, it doesn't work for those rooms. Those rooms are enormous, and those rooms were basically set up with a projector from the ceiling, and it's not good. If there is value in making those functional to where you can stream to Zoom, YouTube, you can have anybody in the room hear clearly, speak clearly, you know, anyone can see if you're doing a presentation in there. This is pretty much what it'll cost to do that correctly. Like correctly to where you can do anything in those rooms from an AV perspective. Both rooms. And if you want to run them both at the same time as one gigantic room, that would also be a synergistic thing. So
I've gone to several trainings out there.
Mhm.
No, I agree, it's not top notch.
It has some
But-
challenges. Yeah.
I will say it serves a purpose.
Okay.
It's hard for me to digest 250,000 when I've been to training there, and I don't know that I would have got any more out of the training had it been $250,000 more video equipment.
Mhm.
I'm sorry, but
Yeah.
and I don't know that we should be footing all the bill on that because it is the fire training center.
Mhm.
I think, city or whoever could also be thrown into that, because city fire uses it probably more than anybody does. Personal opinion.
I support the AV at the EOC because the health department right now meets in the West Campus boardroom, violating absolutely all of the protocols that they talk about. They can't sit 6 feet away from each other. It's impossible. So having access to a larger space, I mean, they used to meet there, did they not?
Yes. They
And,
used to
and
go
they
to the
can't,
EOC.
because you can't hear anything there. I've been in that room. And Harley, I don't know what size of meetings you're at there, but when I'm in those rooms, in my 3 years at trainings, there are many obstacles. There's many obstacles. So it's a necessary upgrade, I believe. Fiber to the EOC, these to me are in a new world. That to me, this looks a lot like basic infrastructure.
If there's not stomach for that number, if there's another number that can be stomached, we can do a design based around that number. And if it'll work, it'll work. We'll send it out to bid and do it. If it's not going to work, we'll not spend the money and leave it as is until more funds are available. Those are gigantic rooms, and that's what it would take.
And I don't have a problem with the fiber to the EOC. But the audio visual, I think 250 is obviously top of the line everything.
Believe it or not, no. No,
We do not need top of the line.
it's functional.
We need maybe some upgrades, but it doesn't have to be, top echelon cinema center here, we want to be able to hear people on Zoom, and obviously Ann's had some issues with the Zoom. I understand that, but I think upgrades to 250,000, I think there's a big difference between some microphones and 250,000. I think that's pretty high. I could probably live with maybe 100,000 for the improvements, and I think that would get you a long ways.
Oh, it would. It would absolutely get a long way. We would design it around that, and if it was acceptable, we would run with it. This is to replicate similar functionality that you have in your boardroom. The courtroom's West Campus, so functional and good. I would not call it top of the line. It's not Crestron, it's Extron, but so.
Jay, your thoughts?
I think I'm gonna need a recess on the ARPA funds, just on how we use it. So I've got some ideas. I might need to speak with our budget director just on before I do. 'Cause I mean, I would really like to look at those external applications. So all the ideas are fine, we've talked about those, but I'm gonna reserve my comments on ARPA funds for a later date. But I've been a proponent of new technology, so.
Nathan, are these things that you need in your budget? We say ARPA because they can be funded by ARPA, but the fiber to the EOC, I think that probably should be a budget item for you, whether it's ARPA funding or not. I mean, we were looking at greatest availability to spend ARPA funding that we might want to, Stella, you were talking about replacing budget of our own, the county budget. So that's why I think, that's my understanding why things are coming in as ARPA proposals. Maybe some of these can be also considered budget items, budget improvements.
Yeah, I think you're on the thread that I was thinking but didn't say. So I just would like more clarity on, from the board's vantage point, what buckets we're moving to. And if at the end, maybe the buckets get eliminated because we can spend up to $10 million of ARPA funds on general stuff, then so be it. Let's get to that. So then we can just make decisions. But we've got other external applicants that are calling, probably all three of us, saying, when are you gonna do it and why don't you like me? I'm like, well, we haven't reviewed any ARPA funds, but now we're starting to do that, okay? And so it's disingenuous to them to say, well, I don't know when you're gonna get going, but we're gonna look at all the internal ones and hopefully there's some money left over. So I'd like us to reset the process of, this is my request for the board, of when we're gonna do external applications, internal applications related to ARPA, or we're gonna just, you know, muddy the waters and just call it funding requests and then take them. I'm okay either way. But this is gonna be clunky if, you know, I don't wanna look at ARPA ones now because I wanna do external first. And budget one after another keeps coming in with these requests. So probably not for the department to answer, but more for the board and or our budget director and how we'd like to proceed. Because the rules have changed and we've gotten more guidance. So it's no fault of our own. We've just gotten more guidance from the federal government on what we can do and how we can use these funds, which we did not know back in September.
And I think, Jay, that Stella, you're there, maybe you can go to the podium. The departments that we're hearing from in budget, the schedule that was sent out to us is everybody's coming in with their ARPA requests. I mean, I think that's 90% of what you're bringing to us in the budget.
Yeah, as we set the budget, we thought we might be further along with our external stuff than we are today. And we thought we would save time during budget, having the budget proposals and the ARPA proposals from the department heads at the same time. 2 weeks ago, I believe, we got the final regs from the federal government on the SLFRP program, which changed a few things and changed what we can do exactly, not changed, but clarified, where we can use up to $10 million of our allocation for revenue loss without calculating that loss. And they changed the formula so we could calculate and go higher even if that were possible. So there's a discussion at the board level of where we go with that information and how we address the external applicants. So I think it's a work session dedicated to the board of where do you want to go with that?
Yeah, I'd love to have that work session.
Yeah.
I think that would help gain some clarity and maybe we can figure out the priorities and or buckets of what we want to fund. I just don't want to get, you know, through all of our internal departments and ARPA requests and then go to the external one and goes, oh, there's only $500,000 left. Thanks for all your time and energy on the application and the survey that the public filled out. But we had this, you know, so I would like to be able to allocate funds for all the buckets, external, internal.
I think we did have that discussion at our last meeting and we had kind of brought up the 3.5 to 4 million for external.
I'm okay if that was, you know, generally, I would like to see that confirmed. If that's the case, that's exactly the direction I'm liking. And now hypothetically, not to have the conversation today in too deep of depth, you could, as I think, you know, ideas are floated, you could transfer those funds from payroll and then ARPA funds could just quote be general basic funds. So you didn't, you know, you could use ARPA funds for normal county functions. And now you don't have federal requirements for these types of requests. You just make them out of the general basic, which we've been doing since you've been here, Nathan. And it's a lot easier.
But was that right, Kevin? Is that what we had kind of talked about, that 3.5 to 4 million for external?
Yeah, we had talked about that. And then some, I believe Ed had sent out an email to each of the supervisors with kind of the list of everybody and looking for some information to try to move forward with maybe scheduling some of that. So we're going to meet tomorrow and
yeah, I think we can have a work session, meet it, and then if you can get us to agree or make a decision of some sort with a number, I would feel much better than that. If whether it's the number Supervisor Potter just said or a different number, just to know that we have those for external applicants, then I could say, hey, we have funding here. It's coming. It is defined. Right now, it's not. It's that that up in the air is tough for external applicants. Internal people, they know how this game's played related to budget and they go through it every year. So I'd just like to give us a little more consideration for the external people and or the budgeting for them.
Okay.
Harley, I recall no conversation where we said $3.5 to $4 million for external applicants. That might be conversation that you had with individuals, but I don't remember the board talking about that number at all.
I thought we did, because actually I did up a thing and even sent it to Ed with that number. I had to get it at the board meeting here.
That was this is Auditor Dragato. That was an email that Ed sent out to all three supervisors. That was sort of our way, I believe, as a group of getting a feel for what everybody had. I don't know that we received any response back from anybody other than Supervisor Potoff.
Right.
So if there's a way to get responses, you know.
Well, I think have a work session on it. So it's obviously there's some clarity that's needed. So let's have a work session and, you know, get to that number. That would what I would like to do, and I would love to have it sooner rather than later.
I think we could put
Would
something
we
like
have
that.
a half hour next Monday night?
Yeah.
To do a work session, and is that good with you, or?
I mean, work sessions are fine. I'm not sure I don't think it's a 30-minute discussion, probably. I don't, I think that the number you're talking about is something that maybe was just the staff was throwing out that as a hypothetical example.
Arbitrary number. I mean, it was what it was. I mean, I thought it was in the meeting here where we had discussed it actually on the last. I thought it was brought up.
So our budget schedule next Monday is scheduled from 1 to 4 again, and then your board meeting will start at 5. So we could do a 4 to 5 work session to talk about this topic.
I think we have disability council at 5, right? And the meeting starts at 5:30, or okay, we could do 4 to 5 if that would work. Ann or Jay?
Fine, yeah. Whether it's squeezed in at the top of the hour at 1 or at 5, I'm open. Just,
I think it'd be well, don't know what's all on the agenda yet.
might not solve it in one little 15-minute meeting, but
Well, we're also meeting Wednesday of this week. I mean, this relates to a budget discussion.
I agree.
So I don't know what, who's on first for Wednesday, and the Board of Health. I mean, they're bringing in a couple $1 million worth of ARPA money. So I don't know that there's any reason to delay. I mean, maybe, we best get this conversation out of the way if we're gonna, as Supervisor Wickham has said, if we're gonna take buckets and say, we're gonna put this in a category and only spend, that's our limit. I mean, my assessment has been different than this individual bucket versus this. I've kind of evaluated all of them and said, these are my personal priorities in terms of need. That's where I am. I think there probably will be folks that submitted external applications that will be disappointed, but that's how this is.
We're just looking at the Wednesday schedule. It may be a shorter day to do it on Wednesday instead of the Monday and then a board meeting. So if we put it first thing on Wednesday, a discussion on ARPA and how external applications and bucket type
that would work for me.
discussion, for the board.
Okay, said sooner rather than later.
Okay.
That's fine. I just
right.
think we need to get some numbers down that we know where we're at.
Agree. I said that
We
about
can
9 months
move
ago.
forward with some things.
Just as a reminder, we do still have a budget proposal from Nathan.
Who?
Okay.
Yes, we'll see it. So, okay, good interruption though. Help set some precedent on our ARPA stuff.
Go ahead, Nathan, sorry.
You're all good. A little bit of housekeeping to go full circle back to your question, Supervisor McDonough. I actually have it called out on my projects in this, what is qualified for ARPA of the original role. And now obviously the roles are even less restricted, but anything that I have labeled as ARPA can come out of that 9 million above 10. It can come out of there. Everything's fine. So, all right. So related to middle mile, but not required for middle mile. We have numerous parks and campgrounds and conservation assets that would benefit from having public Wi-Fi, potentially security cameras, connectivity to some of the ranger houses throughout those locations. This is for fiber and conduit, and this would hit, you know, most of the areas along that would make sense. Like, we're not going super deep into these places, but we're at the places where people would congregate, and it would make sense to, you know, pop a nature camera or pop a security camera. So that's, I made a total of it. This is all still in the original packet, but this would apply whether you do middle mile or not, because we can certainly use this for our current internet providers at some of these locations, similar to what we're doing now. I mean, we have, this just makes it fuller. It makes it deeper into the locations versus right at the location, which is all we have right now. Okay, generator courthouse. We really need this desperately. We lose power here a lot, far too often. And the UPS can only make it an hour, 10 minutes. And it takes 27 minutes. I've had to do this enough times that I have it timed. It takes 27 minutes to shut the data center down. So we need a generator. I got this number from Chris Soder. We're not going to power the whole building. We're going to power the stuff that the UPS powers, maybe some emergency lighting. We are risking catastrophic data loss if we pull the power on the data center without gracefully shutting it down. And I can tell you that the data center, every time we shut it down, you don't shut a data center down. Like, you don't do that. It is heart stopping every time we do it, and heart stopping again when we power it back up and sit there for 45 minutes hoping that the SAN comes back up. And yes, it's a good SAN and it works, but we need a generator. Okay, so video court for courthouse. I'm going kind of quick, but jump in, please. I mean, so video court courthouse, this is multiple projects. If you refer back to the original ARPA proposal, it is necessary funding to finish the courtroom AV. I have rollover from that project, but I did not have enough to finish courtroom 3. So there's like 30 grand in this to do courtroom 3 to match north, south, east, and west. There is money in there to properly do those existing courtrooms with better video. When we did the original design back in 2018, the stakeholders didn't want to do cameras. COVID changed all that. So I was able to get a camera per courtroom. So they are doing video court, Zoom court, but it's a ad hoc solution. And I'd like to make it better with cameras on the witness, cameras on the judge, cameras on do it right. And then there is the full replacement of the current video court that is between the DLEC and the courthouse. That system is going to die. Some morning it's not going to work, and we're not going to be able to fix it. No amount of skill from DLEC, no amount of skill from County IT is going to be able to fix it. It is ancient. The companies are all gone. It needs to be replaced. Ideally, we would do it as part of this, finishing the courtroom number 3, because video court is in courtroom number 3 currently. That is where it is. And we would use the other bucket then to make it work in other courtrooms. I don't know if we're going to make it work in all of them, but there is a desire to have 2 rooms over in the DLEC and at least 2 rooms over here, maybe 3, so they can have mobility and flexibility with it.
We received an email from Shane Buckinstead today, supporting all of these projects for the courthouse and reiterating how much of a priority they need to be.
Digital records health. So I actually have this in a Board of Health grant that, fingers crossed, I actually do think it'll be approved. If it doesn't get approved, I would still very much like to do this. If there's a fire at West Campus, if there's something out there, those records are gone. And they have to keep those records for decades. It's a code thing. They only exist in those filing cabinets. This is more than just scanning. This is scanning them in and then making them available via Beacon. So people can get the permits online through Beacon for septic inspections, well permits, make it much more interactive, keep people from having to come to the health department. It's an exciting project. We've done a lot with Patrice before she retired. We've done a lot with Beacon. I'd very much like to do it. I'm hoping the state will fund it. And we should know, hopefully, I don't know if we're gonna know before budgets is over though, but we should know semi soon. And Sam is fully on board too. Like she's probably more excited than Patrice, so. Okay, my regular budget presentation now. Okay. Department overview, updates, capital and operating. So this changes every year. The numbers go up, they don't go down. Nothing drastic, but you know, we keep supporting more and more stuff. Department overview. My staff has not changed since last year, although we have started new interns. We did not have them all through 2021, just to keep everyone safe from COVID. They started, one of them started in September, then of course Omicron hit. So we're making it work. We're doing our best, but we're thrilled to have that program started up again. They are a valuable asset to our team, to the county, and it helps them. I mean, our interns have gone on to find success in a lot of great companies. Locations. So new location, EB Lyons, sort of a new location, DLEC. We finished the fiber project. We have the county Wi-Fi in strategic rooms over there, and it is in heavy use by people who are in those rooms. We can see them jumping on. We're thrilled that we were able to get that over the fence, work through some of the hesitations by individuals, and it is now in use and working, and there's enough fiber. We'll be fine. Like anybody who needs fiber between DLEC and courthouse, we got them covered. We talked about the replacement of INET out to the EOC. It feels like there's consensus for that. That EOC gray line would go away if we do that partnership with the city for 100K. We still need to figure out the federal building, but you know, one thing at a time. Usually there's more stuff on this slide, but between COVID and the remodeling, we're status quo up there. We're keeping them running, keeping the hamsters fed. The remodel is going to be great. Looking forward to it. I am also very, very close to having a proposal for you to review to have city fiber from courthouse to Sunnycrest. Very close. And hopefully we can pull the trigger on that very quickly once I get it in front of you. Okay, updates. As we spoke, courtroom number 3 is the only one that isn't finished. North, south, east, and west are highly successful. I know it took a lot of years to get there and a lot of blood, sweat, and tears, but it really did turn out really well. Stakeholders are happy. It's in constant use. I very much would like to finish it and get it over the line and do courtroom number 3 like the others. Law library, I've started that with CJ. We've got some really good ideas. He's enthusiastic about it. It's going to help him. It'll help IT because there's a lot of remote testimony that occurs in that room, and it's just murder every time we have to do it. Well, it's a poor choice of words, but it's terrible because we don't have anything set up in there. Fiber to the DLEC is done. It's in. We have ample enough to go forward to do it. Email archive is in and done. Move to a hosted version. I'm going to work with HR and county attorney this spring to make sure that we are still good with the email policy, because per the policy that we created 3-4 years ago, at 7 years, they purge. So we're gonna review that, make sure that we're in good place, because July 22, it's gonna start deleting emails that are 7 years and 1 day old. Network state, I got a call, network administrator Darren McCarthy and our vendor Globalcom, they did a fantastic job. It turned out to be far more complicated just because this building is a rat's nest challenge anytime you try to run wires in it, but it worked out well. The state's great. We're sharing resources. They now match the rest of the wiring building. Boss room, we've got the first initial step going. Zoom works properly in here now. And the GPS system is it's everywhere. I don't know if anybody's been on the public portal, but it's a success. They're sending photos. We've got video. Ted, Ched, and Anthony are using it for data. There's next steps. There's other things it can do that I'll be working with Anthony to map out what he might want to propose to expand it, because we came out with a very targeted version of this. And what was my last? I can't see my last slide. Oh, Sunnycrest Manor, thank you. Yes, we are very, very close to getting a proposal from the city. I know what's going to be included in it. I just want to get it formally in writing. And once I have it, I will get it in front of you quickly, because it would segue very nicely to potentially the EOC fiber piece, all one-stop shop design. Okay. So future needs, future things coming up that I'm going to be bringing to you during the year, and certainly at budgets most likely. The Wi-Fi, most of the access points were purchased in 2012, 2013. As we've added locations, West Campus, obviously, those are newer, but the vast majority of them are from that era. They're working fine. They're good. We have good Wi-Fi. We have good signal strength everywhere, but we are falling behind on standards. They are going to start failing on us. I would like to start working towards a replacement cycle where we buy, 20 a year, 25 a year, and start rotating them out. Nothing we need to deal with right now, but it's going to come, so we stay current. I had this on last year, and I did not get with you or do enough intentionality on it with everything else that occurred, but I do want to have a specific, more intentional strategy and funding to reduce our on-premise footprint. Maybe that means we use AWS, maybe that means we use Enceva. There's a lot of options out there. Currently, we use a fair amount of Azure, and we will continue to use Azure as a phenomenal hosted data center service for some of our needs. I don't know what it looks like when we're done. If funding is palpable, I could easily see us 80-20, where we have a very small on-premise footprint. Remote work has kind of changed a lot of my planning and strategic looking forward. It's here to stay. It is quickly becoming part of the culture of some of the departments. And remote work is a bit of a misnomer. I would say 99% of the stuff would be more hybrid work. They're not 100% remote. They're in and out of the office, they're home for whatever. But it has shown that there are deficiencies in some of our items, such as inbound failover. We have outbound failover. If CenturyLink dies right now, you won't even know. It's going to fail over. It'll be graceful. You'll be good. Inbound failover, though, is much harder to do from a networking perspective and routing perspective. But if CenturyLink goes down, the VPNs go down. Every remote worker is offline. A whole bunch of our locations go offline. So that's been something that we need to work towards addressing. Staffing. We had 7 locations that we supported when I devised the department in 2014. 2015 is when it was approved. We now have 20. We have added Wi-Fi, we've added security cameras, GPS, we've added a lot of systems. I mean, this is just a brief glimpse. If Middle Mile and Dig Once is done, that's not going to live entirely with IT. That's too big. That needs hats from other departments and their responsibilities to assist, but it will increase some of our workload as that gets rolling. Remote workers and hybrid is also stretching us thin in after hours and weekend support. Not asking for somebody this year. I'm not saying I will ask for somebody next year. I'm saying I'm going to be intentional this year, looking at what I am comfortable with where we're at or not at, and bring proposals to you. Or not. Okay, so I did a survey with all the elected officials, department heads. I got really good response. I sat down with about half of them on Zoom to talk about their vision for remote work and hybrid and all of that good stuff. I think it's pretty clear that most of the leadership is on board with hybrid type working environments. There's not that many guesses of who said 100% on premise, but most department heads are hybrid. They want the flexibility to have their people work remotely. I found some of these interesting. This is just FYI. I'm not doing anything with it. It's just educational for the board. Questions and numbers kind of speak for themselves. And then this one, I'm happy that this was answered. It means we're doing it correctly. We're providing the tools. We're giving the support that we need for them to navigate into this new reality. The fact that one said no for organizational was interesting. I made these anonymous. I have obviously the answers, but I need to go back and see who that was. I also asked them if there's any comment that they want to give me personally to help make sure that I'm not missing the forest for the trees, and got some good feedback from it. And I told them that it would be anonymous to the board. I reached out to this person to ask if I could use this quote because I liked how he phrased this: here, whether we are ready or not. It's here. Unless the county wants to do a 180 and start clamping down on remote work and hybrid, it is here, it is being used, it has been. I don't see this changing course. Okay, capital projects. We need a new SAN. There's nothing functionally wrong with what we got. It's humming along fine. We're just really running low on space with the current needs and forecasting out future needs, health scanning, new GIS imageries, just natural data growth. We cannot accommodate it. We just don't have enough space. No matter how many trickeries or moving things around, we just can't do it. I did submit this to the Board of Health grant. I'm hoping it gets approved. So if it gets funded from that, amazing. Otherwise, I mean, this is really high priority for me, is to replace this. Firewall renewal. We're going to end up at the 5-year mark, which is what we purchased on the front end of it. It is a next generation firewall, so we're not actually replacing the firewall. We are replacing all the subscriptions, in this case for another 3 years, which would be appropriate. At that point, the hardware will be 8 years old. We'll be looking at needing to replace that. Maybe we'll do 1 year after that, but 8 years is quite a while for a machine that gets hammered as much as this. I did submit this to the Board of Health grant, and as of the final ARPA roll, this is allowed. It is a cybersecurity device. So if the board wishes to pull this from ARPA funds, that is also allowed. And not out of the $10 million bucket, out of the $9 million bucket, because they added cybersecurity as part of that final roll. Okay, so I've mentioned this in the past, and once I got deeper into it with actually vetting contractors and exploring this, it was way more expensive than I thought. So I'm submitting it as a capital request. This is cyber hygiene. This is best practice. This is hiring a reputable company to essentially try to hack us. It is commonplace in banks, in other high stakes industries. We will learn a lot from this. My intention is to work with Auditor Dragato and County Attorney May to shield this from FOA requests. That would be quite unfortunate if we did this and then someone did a FOA request on our results. So it's doable. I've talked to CJ about it. We just have to have him basically do the contracts and be the point person and then talk to me. There is cybersecurity in the infrastructure bill. It's matching grants. So that could also come potentially, again, the guidance isn't going to come out until May or June, but it is there. But this is also cybersecurity. So as of 2 weeks ago, you could also use this for ARPA funds. This one I threw in here because I really would like to get the project done. So I'm submitting it as a capital project. This combined with my rollover will let me finish courtroom number 3, make it same with everything else that's already been done. If you approve this, we're going to run with this very quickly because I'm going to use the rollover funds now to get hardware, and then we'll work on waiting when this can be done for the labor. The lead time on this kind of stuff is pretty high now, so we would order quickly. But this is also in that big ARPA courtroom AV number. VMware hosts. So we put these in 17. 6 years is pretty good. Like, I don't want to really go longer than 6 years. So in calendar 2023, I'd like to replace these. So that means either approving it this fiscal year, or I would ask to have it approved next fiscal and probably at like the March, so I can move on it faster. Most of the servers of the county live on these. The days of having 50, 60 servers in a data center are long gone. You have, 6 or 7, and the other 50 servers are virtual, and that's what these things are. There's 3 of them. The backup system, we are unable to keep as many backups as I'm comfortable with. Right now, we can handle about 6 or 7 days before it starts reclaiming the previous day's backups. I mean, we get 6, 7 days, which is all right, but I'd really like to go more. And every new system we add that needs to be backed up is going to reduce that gradually. It's also from 2017, so it's nearing end of life. I mean, it gets hammered. This thing runs nonstop all night and then almost all weekend. It's time to replace it. I'd like to do it in 2023 calendar. So again, this fiscal or next fiscal. Okay, Anthony, I don't know if you're still on and still with us. I hope so, but if not, this is with Anthony, traffic cameras. He definitely wants this. He can speak more to it next time, we're together, but there is several locations around the county that would have value to have a traffic camera. John Deere Roundabout is a real low hanging fruit example. There are other locations that would be useful. We would also work with the sheriff to see if there are hot intersections that he would like to have. We certainly are not proposing anything on par with the city, great for them, but this would be strategically located throughout the county where it was possible. It's not possible in a lot of locations, but where it's possible and there's value, we would like to put traffic cameras up, as many as we can do, given the funding amount. This could be 4, 5, 6, 7, 10. I mean, until we get into it, we aren't really truly gonna know. Could be more than that. NAC, Network Access Control. We have this running on the Wi-Fi currently. It's what happens when you try to join the county employee with a device that's not authorized. It dumps you on guest. It knows who is who. It protects all of our Wi-Fi networks across the county. It works fantastic. I very, very much would like to put this on the wired network. Same system, same technology. We've proven it and baked it on the Wi-Fi. Moving it to the wired will greatly reduce our vector, our security vector. We have a lot of locations. We have a lot of network jacks. People can put a honeycomb in, they can put on a UPS shirt and act like they're doing something. There's a lot of ways to social engineer your way into a location to put something nefarious on the network. I don't want to make it sound like if they did, we're instantly hacked. There are layers in there to protect it, but this is the ultimate gatekeeper. You plug something in that is not allowed, it dumps you into a quarantine. It would also be allowed in ARPA expense. Ideally, we do this first, get this in, baked 100%, and then we do the penetration test, because I guarantee you the penetration test is going to do this with honeycombs and stuff under, honeypots under people's desks. Okay, this is an expansion of last year. Last year, the board approved $100,000 to start getting some of our fiber house in order. Then, of course, ARPA came 2 months later. So it kind of upended that math. But a big piece of the previous 100K, I'm hoping to get Sunnycrest hooked up, along with getting us to the meet me point, and then any miscellaneous pieces for the EOC. I would like to continue that and get those done and baked, and then look at other locations. I understand that there is a hesitation for leased locations. I get it. That was last year's marching orders. There are needs, though, that may go faster than what those locations are going to do. So in my case, I'm talking about the federal building. INET needs to be replaced. Like, we have to get off the INET. I understand we leased that location. I would like to intentionally explore that along with other locations. This bucket would allow me to bring proposals to the board to review. And it's an allowed expense through ARPA. So, you know, again, ARPA came 2 months after the first approval, so. Okay. This is just for funsies. It's a map of all the county locations, just to kind of give an idea for fiber and ARPA and middle mile and dig once. It does not have the radio towers on it. It does not have the county libraries, but it helps me kind of get a visual of where are all of us, and we are everywhere. Okay, project recap. If anybody needs a recap, I can go back through them, but otherwise that's the recap. So okay, operating change. We've absorbed a lot of systems over the last few years, and some of them are now fully installed. GPS, agendas, endpoint protection. It's basically antivirus, next gen malware. We bought a 5-year license up front that is going to expire. I'd like to move that to an annual renewal. Fillmore, Mud Lake, Massey, and New Wine should have Makokata Valley service sometime in this summer and fall. I would like to be able to sign up as one of their first customers in that location. That is not required to do the ARPA conduit stuff, but if that was also approved, we could really do those pretty awesome as a combined project. Security cameras have a 5-year warranty on them. We are seeing more and more failures. I would like to move those into a rotation where we essentially replace 1/5 every year, 1/5, 1/6, somewhere in there. that would be the ideal path forward. So when a camera does fail, we can just do a warranty request and get a new one. Otherwise, it's coming from my repair budget, and we're gonna have a lot of failures here over the next 2, 3, 4, 5 years with all the cameras that we've got now. Decreased other lines for right sizing. That would be my operating request for the coming fiscal. And we're at the end. So pictures of snow equipment in progress. These all have GPS. The one on the bottom left is actually from the camera. Pat and Chad were super nice and got me some action shots. So we are at the end. I am still fired and wired if there's more questions, but
Summary of your capital improvement requests, this dollar amount you didn't keep, yeah. I'll just quick do some math here. So, thank you. All right, 611. All right. You know how that's compared to previous years at all?
it's high. 2017 was a high year. So, and a lot of that's coming due now. So we're kind of back there. I'd have to go back and check. It is higher. I wouldn't say it's a ton higher, but yes.
Thanks.
You have anything else, Jay?
No, I'm good. I don't, you're, I think, only our second one. I don't think we've necessarily approved. We didn't even approve our own budget.
No, I understand. This is how it rolls. So I am available to come back
Great
anytime.
presentation. I mean, I think they're very thorough, and then thank you for your patience as we kind of
course,
wade through some of the fiber stuff and ARPA stuff as well, right in the middle of your presentation. So
happy to do it. Thank you.
good.
Thank you, Nathan. Ann, do you have anything further?
Nathan, great job. Great
Thank you.
job. Thank you.
I am available anytime to come back as things get worked through. If there's further questions specific to the regular budget, obviously ARPA, I'm passionate about. Anytime, individually, as a group, just let me know.
Ready? Nice. Maybe the last just idea, just put in your thought. I didn't see any consulting for, you know, the fiber projects at all, either employees or consultant dollars. It seems like with that size and scope, certainly having your lead and your knowledge, but having somebody designated to that might make sense.
So
as it gains more validity.
yes,
Did you have some in there?
so it's not in the PowerPoint, but in the proposals, there is a,
The ARPA ones, okay.
yeah, it's in there.
Okay, good.
To where we would bring a professional company in to help us. I see that as two things. One, help Anthony make a template, baked bridge design for his piece and dig once, and he would use that to replicate going forward. And then also certainly for design of, say, Heritage Trail.
Mhm.
I mean,
Sure.
that kind of goes back to the more you do, the less you're going to need, but you're still going to need surveyors and you're going to need designers. So yeah, it's in those proposals.
Okay, great.
Yeah.
Good.
Cool. Thank you very much.
You're done. Thanks.
Thanks, Nathan. Ann, do you have anything further?
No?
Okay,
So we were supposed to adjourn because these are all scheduled. Is that what I understand for Thursday? Thursday 1? Wednesday 1 as well. We changed that, didn't we? Okay, so I can take Thursday off.
Yep, no Thursday, just Wednesday 1. We'll start out with ARPA work session that we just discussed, and then move on to more departmental presentations.
Stella, what is the Board of Health presenting? Is it one idea, 3 ideas, 4 ideas? What are we going to expect from them?
I discussed with Samantha, she will be presenting the Board of Health request for restructure. So we don't have a Food Policy Council or the Mental Health Court scheduled yet as departmental items. Samantha will just be presenting the Board of Health specific request.
Right, but that's a previous Board of Health with previous executive director. I mean, I'm not sure that this board, current board, is still figuring stuff out.
I think it was approved maybe at their last board meeting to move forward. She can, no,
Well, it wasn't with the current board is what my point is. This is the previous board. And actually it was, Patrice Lambert. So I don't know what's, I guess I'd like to have her address that if you'd please, see.
certainly.
When are they scheduled? Wednesday?
They're scheduled for Wednesday.
Okay. All right. Well, we will hear from them Wednesday. I assume Samantha's leading that along.
Samantha is leading that, yes.
Is anyone coming with her?
I would assume her board is, but I don't know that for sure. I think Tom was originally scheduled to come with her. I don't know with the change in leadership there, what the plan is today.
They meet monthly, so they're going to be outside of our budget window. Most of them must have a special meeting. So probably good to meet with them sooner and maybe we can learn together and they can revise it.
Sounds good.
I will make a motion to adjourn.
Second.
Wednesday.
Have a motion and a second to adjourn. All in favor signify by aye.
Aye.
Aye. We stand adjourned.
Thank you, everyone.
Thank you, Ann. Yes, we'll be